find that. Sorry. Please.
Greetings, everyone. Jambo. I know that by me saying Jambo, it already tells you that I am from Kenya. My name is Laura Nyiha, and I am from Kenya. I will be your MCA for today. Sorry, I will be your Master of Ceremony for today, what most of you would prefer to call as MC. So welcome to the World Antimicrobial Awareness Week webinar, dubbed One Health Approaches to Tackling Antimicrobial Resistance. Yeah, and I'm really glad to see your faces. Okay, not your faces. I can see your names on the list of participants, so feel welcome. This event is a joint project coordinated by FAMSA and AMSA International in collaboration with EMSA, IVSA, IPDSA, and APDSA, which was created to just raise awareness on antimicrobial awareness, and also increase the circle on the antimicrobial stewards, to just generally make it known to the people, not only in the health field, but also even in the grassroots in the society. So welcome. We have a lot lined up for you. Together with us are 6 esteemed, really esteemed speakers, and I can't wait. I promise you, it's going to be a fantastic time. They're great speakers, great presentation, and also our moderator today will be Leonard Liam, the Director of Public Health of AMSA International Philippines. Along the way, you will be given a chance to interact, to ask questions. So don't feel shy, interact, ask questions. Later on, I'll be giving the ground rules, but feel free. This is just an interactive session, learning from each other, such. Before we begin, we would like to play our World Antimicrobial Awareness Week video, which was created by our representatives from different countries. So yeah, I hope you enjoy.
Every year, more than 700,000 people die from microbial infections, with millions in critical conditions. However, this is not because of the lack of drugs to combat the infections, but it is because of the abuse and indiscriminate use of antimicrobials, leading to antimicrobial resistance.
Antimicrobial resistance occurs when bacteria, fungi, viruses, and parasites resist the effects of medications, making common infections harder to treat and increasing the risk of disease spread, severe illness, and death.
World Antimicrobial Awareness Week aims to increase awareness about global antimicrobial resistance and encourage best practices among the general public, health workers, and policymakers to avoid the further emergence and spread of drug-resistant infections.
It is our duty to follow the Global Action Plan to tackle this growing problem by improving awareness and understanding of microbial resistance through sensitization, education, and training.
Join Asian Medical Students Association International,
Federation of African Medical Students Associations, International Association of Dental Students, European Medical Students Associations,
International Veterinary Students Association, and the Asian Pacific Dental Students Association,
as we stand united to preserve antimicrobials. Follow and engage with our updates on Twitter, Instagram, and Facebook as we come together to make the world a healthier place.
Fantastic. You know, as it was said in the video, that when we come together, we'll make better things. Things will be greater when we come together and raise awareness on antimicrobial awareness, on antimicrobial resistance. Even your relatives, your friends will know about it and will take caution about it. So before we begin our discussion, we will start with, I will welcome the AMSA International Chairperson, Marjorie, to give a welcoming speech. Marjorie, the floor is yours.
Thank you so much, Laura. Hi, everyone, beloved members of Asian Medical Students Association International, Federation of African Medical Students Association, European Medical Students Association, International Association of Dental Students, International Veterinary Students Association, and Asian Pacific Dental Students Association. So hi, everyone. We have all gathered once again for the highly anticipated World Antibiotics Awareness Week 2020. So I am Marjorie, the overall chairperson of Asian Medical Students Association International, tenure 2020-2021, and I thank you, all of you, for your intrigued presence. As the organizations mentioned earlier, this week-long celebration will be impossible without all of you. We thank you. Not to forget the amazing organizing crew that has worked night and day to pull this off. Let's give them a round of virtual applause, everyone. So dear people of tomorrow, antimicrobial resistance was first discovered 4 years after the discovery of penicillin, and that was in 1928. So it's about 92 years. And well, the teeny mini organisms got to struggle to survive, right? So this week is celebrated yearly not to educate you and I to eliminate them completely, but to remind and encourage everyone, the general public and the medical practitioners, to avoid further emergence and spread of antimicrobial resistance. So this year marks another great achievement of AMSA International and her partners. Collaborations like this with synergistic efforts of various international medical organizations should be done more often for a greater impact, with emphasis on pressing global health issues. Today we have a strong, impressive lineup of speakers as mentioned by Laura. We have Dr. Roger Harrison, Dr. Mehdi Amrani, Bert K. Aka, Dr. Shamsuddin, Dr. Ajit Dahun, and Dr. Wendy. I hope that all of you will take this opportunity to ask them anything and everything that you have in mind. Last but not least, we sincerely hope that you will feel empowered and enriched with knowledge, action, and friendship through the webinar today. I will now pass to the next agenda of the day. Thank you and stay safe.
Well, thank you so much, Marjorie. That was really nice. Next, we'll have the FAMSA administrator to give a welcoming speech, Francis. Welcome, Francis.
Hi, everyone, and welcome to this important webinar on the One Health approach. I will be giving this welcome address on behalf of the FAMSA president, Emma Nalianya, who is unavoidably absent at this webinar. It's a really important topic that we're discussing today, the antimicrobial resistance and the importance of intercollaboration between different stakeholders for this very important topic. So it's really impressive and amazing that we get to see students from different fields of medicine, veterinary medicine students, dental students, medical students, and not just medical students from different parts of the globe. We have from Asia, we have from Europe, and we have from Africa. And as a very, very important global health problem, I believe and I know that one of the best ways for us to actually tackle this problem is by doing it together, which is what actually brought about the One Health approach, collaborating together, joining our hands together to actually attack this very important global health problem. So I believe that as we're all here for this webinar, I believe we're going to learn. I welcome everyone who has joined us for this webinar. We really appreciate our speakers who have taken out time to join us and participate in this webinar. We're very grateful to you all, and we wish you a very, very rewarding and enlightening session. And I hope that after this session, we'll all be antimicrobial stewards. We'll all take antimicrobial stewardship a little bit more seriously because it affects us all, regardless of our gender, our race. It affects everyone. And thank you for coming to this webinar, and enjoy the rest of the webinar.
Thank you. I think what I liked most about what you said is that if we want to do it, we must do it together, and it starts with this such collaborative work, and that's really nice. So moving on swiftly, I'm just going to give you a briefing of our ground rules. You know, every house should have housekeeping rules. The first one is participants should state their full names in their respective Zoom platforms. So in the chats, you can start introducing yourself by your full names. Participants should ensure a stable internet connection through the webinar. We do not want you to come in and out and miss some sections. You know, those presentations are going to be really nice. We don't want you missing any part of it. Participants must have their mic off muted. If you're not speaking, please, to avoid interrupting the speakers. Participants may or may not have their cameras on. However, you can turn it off to reduce the bandwidth. Participants are encouraged to ask questions through Slido and engage by upvoting questions. Those are the ground rules that we're going to be operating with. During a speaker's presentation, participants are able to send questions on the Slido. It's easy it's a very simple platform to use. You will state for example, if I have a question for speaker number 3, I will state number 3. I will write number 3 and then insert the question. For example, speaker number 3, then I ask like, what can I do in my society to create awareness? Such. I hope you understand. Questions will be read by the moderator and answered in each speaker's session and Q&A session. All questions are to be read in order of upvotes on the Slido. So what we mean by this is that on the Slido, when you might have a question, and then after looking on the Slido, you come to the realization that someone else has asked the same question you wanted to ask. So there is no need of repeating. We don't want to be verbose. So on the Slido, it gives a chance for you to upvote, or let's say like on the question that has already been asked, so that when we see a question with a number of the highest number of upvotes, that's what we'll be asking first. Unanswered questions in Slido and from the registration form may be asked again during the final Q&A, audience round, and sharing sessions. I hope that is clear, and you will not be afraid to ask any question. Yes, please let us be interactive and ask every question that we can ask. I think that will be all on the ground rules. Next, I will take this chance to officially open the webinar and welcome you. So allow me to say good morning, good afternoon, good evening, depending on where you're joining us from. In Kenya, it's around 3 p.m. in the afternoon. Without further ado, I would want to welcome the moderator, Sir Lim. Welcome. Sir Leonard Lim is the National Public Health Officer of AMSA Philippines, and he will take us through. Sir, the floor is yours.
Thank you so much, Laura. Good day, everyone. Again, I'm Leonard from AMSA Philippines. So before we learn from our amazing lineup of speakers for today, I want to introduce the campaign that today's webinar is advocating for, and the concept of One Health, which will serve as the focal point of the wonderful discourse that will transpire. So following a stakeholder consultation meeting in May 2020, organized by the tripartite organizations, the Food and Agriculture Organization of the United Nations, the World Organization for Animal Health, and the WHO, the scope of World Antibiotics Awareness Week was expanded, so changing its focus from antibiotics to the more inclusive term of antimicrobials. So this year, the tripartite organizations decided to celebrate the World Antimicrobial Awareness Week from the 18th of November to the 24th under the theme United to Preserve Antimicrobials, to facilitate a more inclusive and unified global response by following the One Health approach. So what is the One Health approach? The One Health approach is a collaborative effort of multiple disciplines working locally, nationally, globally to attain optimal health for people. More speakers for today. Okay, now we can proceed with our first speaker. Next slide, please. Okay. So to begin today's session, I'll introduce Dr. Roger Harrison. So Dr. Roger Harrison is a senior lecturer in public health at the University of Manchester. He's also the faculty academic lead for University of Manchester Worldwide. He's a university public engagement champion, engaging students and communities on the topic of antimicrobial drug resistance, spanning to community work in Rwanda, Uganda, and Tanzania. So in addition to this, he is academic lead of the Education Committee for Antibiotic Research in the United Kingdom. He's leading the development of an innovative competency-based curriculum on One Health approaches to containing antimicrobial resistance, with a new suite of learning opportunities starting in 2021 for the public, undergraduate, postgraduate, and professional development. So it looks like today's audience of health science students would be the best crowd to promote these programs. So let's welcome Dr. Roger Harrison.
Good afternoon, everybody. First of all, can I just check that you can hear me okay?
Crystal clear.
Brilliant. Well, we're off to a good start, and wow, what a fantastic welcoming, and to see so many young people participating at this event after what has already been a really hectic 6 to 8 days in World Antibiotics Awareness Week land. There's been some amazing presentations and activities being going on by young people around the world, and I hope all of you will go and catch up on any of the events that were done by the AMR Youth Summit through some of the health professional associations that today many of you will be part of. The Youth Summit was a fantastic collaboration, and I think today's event will also bring in some of the themes and help further the discussion of the topics that were raised then. But let's start by remembering that World Antibiotics Awareness Week really ought to be called My Day of Antibiotics Awareness, because we all need to be aware around antimicrobials, antibiotic drug resistance, infection prevention control throughout our daily lives. And I want you to just start with a pause by thinking, when did you last wash your hands today? I'm not going to ask people when they last did them, but when did you last wash your hands, and when did you wash your hands following the guidelines for the amount of time that you're meant to wash them, use the soap, use the warm water, dry them properly? So the point is that some need to be doing to tackle and to contain the fallout of antimicrobial resistance are to some extent simple things, yet to put them in practice routinely requires behavior change, and it requires some structural interventions to be there, because of course in many parts of the world there isn't good sanitation, so we can't just go into a bathroom and wash our hands correctly. Now, I'm not an expert on this topic, and I want you to remember that, because sometimes when I was a student, and even now, you know, I can think that the people speaking.
And you've got this Google form, and you need to click the answers as normally.
Great. Okay, so somebody else wants to take over my talk. That's great. I can then sit back and listen. So I've also been told already that the audience is very shy. So I hope we can break some of that shyness and get your questions coming forward. Now, I don't know if it's happening on your screen, but I've got somebody who's wiggling around and drawing a picture on my screen. But anyhow, let's continue. So let's go back really to the 1920s. For some of you, you know, you're thinking like 2020, I mean the 1920s, you know, when my parents were growing up, and then when not that long after, when I was born, and I was lucky to be born into the golden age of antimicrobials. And even though we'd had various forms of antimicrobial drugs before Fleming and his team came along and were able to manufacture penicillin in large quantities that we could use it for our own health around the world, you know, this really did set off a tremendous change in society. If you to actually just think, what would it be like if we didn't have any antibiotics? Just take a moment and just think, what would our world be like? Well, to start with, I wouldn't be here because I had meningitis when I was younger, and my life was probably saved by antibiotics. And you know, the lives of many of your parents in these rooms and many of you in these rooms will already have been saved because of these miraculous drugs. And what we need to make sure is that we do things to make sure that these drugs and new drugs in the future will be available to us when we need them, and will be available to be used effectively in the right way by skilled people. So antibiotics, next slide, please. Thank you. Antibiotics have saved hundreds of millions of lives and had massive impact on people's lives. In the west of the world, in Western Europe, antibiotics probably, you know, won the war, the Second World War, because many people were dying because of bacterial infections, because of the war wounds caused by gunshots and bombs exploding and the disastrous circumstances they were living in. So it was probably that Fleming's development and then the later team that were able to produce penicillin in large quantities that had such a good impact. Next slide, please. But then more and more, we've become aware, haven't we, of this term antimicrobial resistance. And for some of you in the audience, this might be a new topic for you. And for some of you, you will have hopefully been learning more about this in your undergraduate curriculum and in some of the sciences that you've been studying. So antimicrobial resistance, could you go back one slide, please? Thank you, stay on this slide. So antimicrobial resistance occurs when these microbes evolve the mechanisms that protect them from the effects of other antimicrobials. It's part of natural evolution. The mechanisms of antimicrobial resistance, you know, have been going on for millions of years, most probably. And antimicrobials, you know, probably already existed before, you know, we started identifying, developing them. In fact, they're in our soil, they're in our environment all around us. The resistance can arise naturally by genetic mutation, by one species acquiring resistance from another, and it can appear spontaneously because of random mutations. And we're only just really starting to learn more and more about how the genetic material is being transferred around our whole ecosystem. And when the bacteria become resistant, as we know, the antimicrobial drug that we're giving either to a person or to an animal species or even to a plant species at times is no longer preventing that microbe from continuing to grow. And so basically the bad bugs are getting better at fighting the defenses that in the past we have so easily relied on. Next slide, please. So there is quite a strong body of evidence to show that the more that we use antimicrobials, the more resistance develops, either in patients, in patient communities, and in our world at large. So there's a relatively strong positive correlation between antibiotics, antimicrobials, and resistance to such drugs being found. Now, we've known about resistance for a long time. And it's really important for you as young scientists, young healthcare professionals of the future to wonder, so why is it, if we've known about this for probably as long as when antibiotics were discovered, you know, Fleming himself raised a concern about antimicrobial resistance actually happening and what the implications of that might be. So for you as young people, you need to think, so if we've known about this for so long, why hasn't much been done? Because it relies on people like you to take the action, okay? Just because we know about something and just because we know something needs to be done doesn't then mean that it goes and gets done. And that's a really important point for you to bear in mind. You know, knowledge has got to be followed by action if we actually want to make use of that knowledge. Next slide, please. Next slide. Thank you. And I'm sure that throughout today, you will be seeing similar slides to this, which really go back to the Lord O'Neill report, which was commissioned by the UK government, which for a change had actually done something very positive on this topic. And they commissioned a large report which refueled interest in this topic around the world when they said that currently, probably maybe as many as 700,000 people are dying around the world each year because of antimicrobial resistance. But the forecast is that maybe 10 million people will die in 30 years, maybe more, could be 50 million people. And one of the problems is we don't really know. We know it's a lot, but we don't know how big that lot is because there isn't good data being collected around the world on this topic. Because antimicrobial resistance isn't itself a disease, it's often not indicated on death certificates or in medical records, so it can be difficult to actually find out what the true scale is. But regardless of whether it's 10 million or 15 million or whatever, we know it's a huge impact, a huge devastation that is starting to happen. Next slide, please. Next slide. Countries like Africa are going to bear the brunt, and certainly Asia is too. Obviously, the larger the population, the larger the actual absolute impact will be from antimicrobial drug resistance. And of course, it's not just deaths. We often just talk about death because it's such a simple and unchallengeable outcome, but the long-term impact of people's lives of living with and coping with the uncertainty of antimicrobial resistant infections is colossal. And I've spoken to patients locally on this topic, and it really does have a tremendous impact on their lives, the lives who are responsible for looking after them. Next slide, please. What we're finding is that in the high-income countries, the use of antimicrobials is just slowly starting to decline. And that's largely as a result of big campaigns, such as those taking place this week, more regulation, changes in some of the European and also greater involvement of the different healthcare professionals and the scientists in looking at the guidelines and the ways in which antimicrobials ought to be used in practice. But unfortunately, in some other countries, as they're becoming wealthier, they're also then using some of that money to spend on antimicrobial drugs. So we're finding that as countries become wealthier, the use of antimicrobials is also going up. Now, we mustn't confuse that with the fact that a lot of people who need antimicrobials don't get them. So in some cases, we actually want to see there to be increases in the use of antimicrobials. But it's more likely that the majority of antimicrobials in some of these lower and middle income countries are being used inappropriately or ineffectively or for reasons that aren't necessary. And the more we bring in antimicrobials into our ecosystems, our environments, our patient and animal populations, the more this challenge of resistance will remain. It will just increase. Next slide, please. This is, it's quite old data now, but this is pharmaceutical sales data of antimicrobials for human consumption, how it's changed over 10 years. If you look at countries like South America, Brazil, huge changes in increased consumption of antimicrobials. Parts of Africa, India, huge challenge there as well, and China. When you look at Africa, you'll see that there's a lot of grey sections, and that's because we don't have data. So many countries in the world, we don't have good routine data on their use of antimicrobials and a whole host of other health interventions. And that's certainly something that's been given more attention. Next slide, please. This is data of the use of antimicrobials by professionals for young people once they've been diagnosed with a respiratory tract infection. That's usually a viral condition, and antimicrobials aren't usually required. But this shows that across different countries, there's huge variation in whether a physician would prescribe an antimicrobial once they know what is wrong with a patient. So when they've diagnosed respiratory tract infection, many are still giving antimicrobials, and the variation across these different countries is not as a result of variation in the prevalence of different disease. So it's purely variation in prescribers' behavior. That's why I said at the beginning, you know, we have to look at our behaviors as much as look at the knowledge that we know around us. Next slide. And as we know today with this One Health agenda, and we have to be careful what we might mean by One Health agenda as well. But when we look at the animal side of things, antibiotic use is massive. And that's because it is used as a growth promoter in animal food and also prophylaxis to prevent bacterial infection getting into animals when they are being reared for meat production. Global demand for meat production is huge, again, largely being fueled by Asia, but increases across all countries, all areas around the world. So we have to start thinking around other ways in which we can meet our protein demands in the whole food supply. Next slide, please. And some of the areas of concern, if we look at on the left, the purple areas indicate significant changes in demand, increases in demand for antimicrobials in poultry farming in India, and on the other side of the slide, in pigs in China. And again, this is representing a massive increase in demand and use of antimicrobials, and we have to find alternatives. Next slide, please. And just to point out, we, easily think that antimicrobial resistance is something that we're creating. Well, we're fueling it. We're certainly adding to it. But for many years, millions of years, it's been around us. But what we're doing in our environment, through pollution largely, we are increasing the presence of antimicrobial organisms in our environment, particularly in the water supply, from, if you think about from pollution, from manufacturing pollution, from the pharmaceutical industries, from farming, and from our own human fecal waste. Next slide, please. And it's not just in poor parts of the world where this is happening. The River Thames, which floats right by Her Majesty, you know, our Queen, by our Houses of Parliament, through our city, and the river and the tributaries in the UK, many of them have what we would declare to be unsafe levels of antimicrobial resistant organisms. But the problem is we don't necessarily really understand what is the impact of this and the extent that this is then causing problems in animal, environmental, human transfer, and in the risk and the effective prevention of disease. We just really don't know enough yet about this. Next slide. And as some of you will know, one of the challenges that we're facing that really brought the whole antimicrobial resistance agenda to light in the past 20 years is the fact that we're running out of effective drugs. The reason largely we're running out of effective drugs is because we haven't been making new drugs to keep up with the changes in our whole microbiome. So antimicrobial resistance is going up, but the drugs available to us to effectively treat those resistant organisms is going down. And the main reason for that really is one of financing. And why would you want to produce a drug when it was a drug that people were being told to use less of? You know, the commercial incentives to do that just aren't there. So new models to incentivize the pharmaceutical industry are being developed and piloted to consider the impact of those to try and re-energize the pharmaceutical industry to create the very drugs that we actually need. Next slide. So we come to this model of the whole one health or one ecosystem, what more and more people are now even referring to as planetary health. And that recognizes that when we break down our different silos, when we start working with each other in partnership across our different disciplines, across our scientific specialties, there's actually a whole synergy of problems and interactions that's taking place. If you just think about it, and when you go to the bathroom, when you go to the toilet and defecate, you know, where does that go? Where does it end up? How many different systems, how many different parts of our environment does it come into contact with? And what might then be happening with that whole microbiological system that you're then flushing down the toilet? So we have to be able to identify ways in which we can work together to make sure that we implement evidence-based principles for the use of our existing antimicrobials, that we minimize their use when they're not necessary, when they're not required, that we maximize their use when they are required. Let's face it, we want patients who need them to get effective drugs when they need them. We need to look at our whole global systems for producing food, meeting demands in food, and we need to make sure that we can do that sustainably and economically to meet the food requirements of people around the world. And we need to look at of pollution, of natural ways in which antimicrobial resistant microbial organisms can get into our whole environment and planet as a whole. But at the same time, we have to look at other catastrophic impacts on our world. We know climate change is having a huge impact on our whole ecosystems. And in doing that, it's having a whole impact on antimicrobial resistance. We're already finding, aren't we, more and more awareness with COVID-19 around zoonotic diseases. And as natural habitats get destroyed, there's going to be closer and closer interaction with humans, and that is going to increase the transfer of a whole host of microorganisms, some of which will become bacterial, some of which are going to need acute and chronic treatments. I also want to highlight a recent report, next slide please, which was brought out by the organization called REACT, that also reinforces evidence produced by the World Health Organization. And that is generally, there is a huge inequality between men and women in the effect, the impact of antimicrobial resistance. Women are more likely to be negatively impacted by antimicrobial resistance than are men. And men are more likely to be the decision makers involved in implementing interventions that may or may not help that situation. So this is a call to arms for the women in the audience today. Your voice, we really encourage it to be heard, to be strong, not just within your student associations, but in your communities and in the professions that you then go into. Next slide, please. So as students, as young professionals, truly you really are the people who can make the difference. People like me, old enough to be your grandparents, let alone your parents, are relying on people like you to lead the way in making the positive differences. So here are some of the things that you can do. In your practice, be you in the environment, be you a dentist, a pharmacist, a medic, make sure that you use evidence-based principles and guidelines in all of your work. We must apply the evidence, and it must be applied in a way that matches your local situation or setting. So use international, national, and develop local guidelines based on evidence. If you are working in a clinical setting, develop antimicrobial resistant stewardship teams or antimicrobial stewardship teams. You must work in teams across disciplines, and don't be scared to challenge your peers in gentle ways, but remember you're learning the more contemporary knowledge that some of your peers may not have come across. So use the evidence to help fight your cause. In terms with evidence, we need better data of what's taking place in our communities. And we need better data on how drugs are being used, on how infection prevention control practices are being put into place, and better data on what is happening to our microbiome and to the particularly important forms of antimicrobial resistance which are developing. Students, these are great projects for you to initiate, and they can make a difference. And set up journal clubs. Set up a One Health journal club. You've shown today that this can be done virtually. So it might not just be with people in your university, but have a global One Health journal club. What an amazing impact that can make to your learning. If you're working with patients or with members of the public or with a farming or environmental community, they don't have this specialist knowledge that you're developing. To spend just 1 or 2 more minutes explaining to them in basic ways what the problem is. And as I said earlier, simple things really can make a huge impact. Clean hands saves lives. We know the importance of WASH and other interventions and other strategies. So make sure that you act as guardians, as ambassadors for implementing those types of interventions as you routinely go about your work. I think that's my last slide. Is that my last slide? My last slide then, remain curious. I say this to everybody, whether they be 2 years old or 20 years old. We need to have open minds. We need to look at this problem from different approaches. We need to develop the evidence, implement the evidence. So we need to always be learning. And there's a whole host now of superb online learning that you can utilize for free. And I've just included some of the information on this last slide for you. And it's now open to the panel for questions.
Thank you so much, Dr. Harrison. So yes, we'll be having the question and answer portion for your presentation. So unfortunately, Dr. Harrison will not be available for the discussion that'll include all the speakers at the end of all the sessions. So we will be taking this opportunity to extend the Q&A segment for Dr. Harrison's presentation by 10 minutes in order to facilitate all your curiosities. So I actually checked the Slido where they sent in their questions already, and I've selected a few that were popular. The first question is, can we even stop the AMR? Can we even stop antimicrobial resistance? What is the right way to approach the people regarding this problem?
So it's an important question, isn't it, to consider what is our approach? And I'm assuming from the question, it's in terms of being able to talk to people, people in our communities around this question, about this problem. Am I right? Is this around how we engage with the public? Mm-hmm. So I think people like me are probably the worst people to be able to try and engage the local community, because I'm used to reading articles in journals. I'm used to attending scientific seminars and things. We need people who are younger, who understand local communities, who are closer to the ground as to what is taking place in and around them. A lot of it is by having open conversations with people. Spending time, just 1 or 2 more minutes has been shown in clinics with patients to be able to help reduce the use of antimicrobials just by spending that time explaining to patients why they may not be needed in a particular setting. And so spend time with your patients, spend time asking questions to them. What do they understand the term antibiotic? Many people don't use that term. I don't know what term they use in your part of the world, so you need to go and ask your local people. So use terms and languages that they use and find a way in which you can develop a narrative that meets the context or the type of lives that they're living.
Thank you so much, Dr. Harrison. I guess just a follow-up. Somebody asked about how to educate those who are reluctant to reduce antimicrobial misuse. So perhaps conspiracy theorists.
Wow, if I had the solution to be able to deal with conspiracy theorists, I'd be very, very happy. I think a lot of it is by having systematic and seamless education. What we find is, don't we, that even in the health professions, that patients or members of the public are having different experiences. So you might say to people, oh, you don't need an antibiotic for a viral illness. And that patient might go to a doctor. And we know that many doctors still give patients antibiotics for a viral illness. So you're getting a mixed message. So it's important that we try and have simple messages which are saying the same thing, that are representing the key fundamentals of the points that we want to get across. And I think some of it is going to take time. You know, in the UK, we've been working on this for a long time and still haven't got it right. But we are being able to make some positive changes. I think you have to use a whole host of different approaches, educational approaches with young people in schools, community events, right through young people. If they go into higher education, in your health professional undergraduate programs, you need to be learning about this topic, and as part of your science communication or patient communication workshops. But on social media, which many people are now being influenced, I truly believe on social media, we have to identify better mechanisms to be able to automatically challenge the conspiracy theorists. And they're using a whole host of technical initiatives that I don't understand, these Twitter bots and a whole host of other automatic responses. And I think that we need to have surveillance or monitoring going on Twitter that can automatically come back with meaningful and informative responses to some of those negative messages that are being sent out. Because as you know, they're very influential. So we have to find equally as influential approaches to counteract them and get ahead of the game. But I also think that we need to start giving a bigger voice to people who have antimicrobial resistant infections. We need them to sort of come out of their houses, as it were, to speak more to their communities about what it's like living with an antimicrobial resistant infections. Because until recently, those patients, they haven't had much of a voice, they haven't been heard of much. You know, we hear a lot from cancer patients about what it's like to have cancer, for example. So I want to hear more about what it's like for somebody to have an antimicrobial resistant infection. So the more that we can show other people the reality of what's taking place, rather than it just being a graph on a particular presentation, when it's a patient describing it more in their own words and how it's impacted on their own lives, I think this will go somewhere to helping.
Thank you so much, Dr. Harrison, for that response. The public health enthusiast in me is really excited about the multifaceted approach to health communication in the fight against antimicrobial resistance. So we can entertain one more question. So what is the current plan of action in limiting antimicrobial resistance, and what is the long-term outcome in low and middle income countries?
So that's a really good question, isn't it? And it sort of refers to the policy agenda. And I haven't touched on the policy agenda, and it might come up more later. The United Nations, which I suppose is our global overarching organization that has responsibility or tries to influence and make responsibility across our individual governments for health and healthcare provision. And there's the UN, WHO, World Health Organization Global Action Plan on Antimicrobial Resistance, which identifies a number of priority areas that need action. And then down from that, many countries have then gone on to develop their own national action plans. And these include things like developing surveillance systems, and there are now some global surveillance systems being set up. And some of those are integrating patient, public human patient and animal surveillance, so we can see what's happening with the antimicrobial resistant organisms across species, not just in humans or not just in animals, but we need better surveillance. We need to make sure that we're using that data effectively. We need better laboratory capacity setting up so that in hospitals and in health centres, better diagnostics can then be made so that there's more certainty around what the patient may actually be suffering from. And we need better education for health, for all health professionals, environmental professionals, agriculturalists, veterinarians, not just at an undergraduate level, but right through as part of their continuing professional development. And there's many more. We need money, none of these national action plans will have any value unless the governments find ways to put money into them. And a lot of money is being put into this agenda, and a lot of money is being put in collaboratively through huge partnerships to developing new treatments, new antibiotics, but also alternative treatments. And it's worth giving some reference to phage therapy, and some of you might be interested, to looking at phage therapy and getting into the whole debate, maybe around why more attention hasn't been given to that as well. So there are some clear objectives which have been outlined for the world, for countries, and then also for professional organizations within those countries to then take forward. But all of that requires action, as I've said. It requires you not just putting things into practice, but also to campaign, to influence, to challenge, what needs to be done. And truly, I'm not just saying this, but you really are the people to do this. Without your input, nothing will change.
So thank you so much, Dr. Harrison. So unfortunately, we have exhausted the time for the Q&A session. So thank you for the wonderful overview of antimicrobial resistance, its epidemiology, and how it must be addressed with a One Health approach So you've outlined the many ways we can empower ourselves and have truly inspired us to advocate for the cause as students of the health sciences. So now I'll be calling on the president of AMSA International, Marjorie Ong, to thank you on behalf of the organizing team.
Okay, thank you. So I was muted earlier. Okay, so thank you so much, Dr. Harrison. I rarely get to actually listen from someone from UK, especially. So, and actually, I have a lot of questions about UK systems and how you regulate AMR per se, but I think the focus is kind of out and the time is very limited today. But I want to thank you so much again for your invaluable insights today. Thank you, and have a great day ahead.
So now we proceed with the second presentation. I would now like to introduce our second speaker. Sorry, the presentation isn't visible. Okay, it's loading, but I'll proceed anyway. So our second speaker is Dr. Mehdi Amrani. So Dr. Mehdi Amrani is Mr. Mehdi Amrani rather, sorry, is a final year veterinary student from the, I'm sorry if I can't pronounce this correctly, it's in French, Institut Agronomique et Vétérinaire. I'm sorry. He is a founding member of the International Veterinary Students Association in Morocco. He has been the vice president and the president of IVSA Morocco. And he's also the president of the organizing committee for the 68th IVSA Congress, which was hosted by IVSA Morocco. And he's also a student ambassador for World Organization for Animal Health. So let's welcome Mr. Amrani.
Okay, good. Yeah, thank you for the introduction. Hi guys, my name is Mehdi. All that was mentioned before. I'm actually also right now the Secretary General of IVSA Global, and I'm really, really glad to be here today. And basically, I'm speaking on behalf of our chair of the Standing Committee on One Health, Mutiat, who couldn't be here. Don't worry about butchering anything. It's fine. You didn't. Anyways. Yeah. So my presentation today is about the role of veterinary sciences and associated livestock, aquaculture, and food industry in AMR. Veterinary, thank you. So I will start by just giving a quick outlook about how antimicrobials are used in veterinary medicine. So we have three uses basically. Growth promotion, which has been talked about and is apparently like very, very important point that we are trying to work on in the profession. Because a lot of antimicrobials are used for growth promotion. We're trying to call into those numbers. The second point is the prevention of control of common diseases, which is indirectly linked to growth promotion, but it's more of in case of an epidemic where you have like some animals that are ill and some that are not. And usually you don't put in place a system of like verifying if all animals are actually infected or not, which costs a lot for farmers and everything. So basically, the common outcome of that is you treat everybody. Third point is the clinical treatment, which is mostly, I would say, for small animal veterinarians, so cats and dogs, companion animals, equines as well, because those animals like usually don't get treated as much, mainly because we don't have like that many infection. Like most of the care that we do is antiparasitics and vaccinations. So about the risks linked to bad antimicrobial use in production animals, the biggest point is the selection of resistant bacteria, which is just a major talking point when it comes to AMR, and especially horizontal transmission of resistance, because when you treat against a particular infection, but you are given like antibiotics and you don't really know what bacteria interact with it. You just know that it treats the infection because antibiotics have large spectra of action. So what we are afraid of is that some bacteria that are resistant actually transmit resistance to other bacteria that are not resistant, which just makes the problem a lot worse. And the other point is antibiotic residues in animal products and the environment, of course, because if you treat cows, for example, there is usually a latency period in which you cannot consume the products of those animals because you are more likely to have high levels of residue in the meat, in the eggs, for example, in milk and other byproducts. Next slide, please. Okay, so here is a table just to have a little idea about how much antibiotics are we consuming and where do we consume them, because yeah, I'm not very interested in the values themselves, but in proportions rather. So here we can say that the table clearly shows the animal use of antimicrobials is a lot more important than the level of like the amount of antimicrobials used by humans. And in animals, a lot of antimicrobials are used for non-therapeutic purposes. So this is kind of a problem here. This is why antimicrobial reuse for growth promotion has been such a big talking point that we are trying to reduce, because obviously a lot of the problems come from there. Next slide, please. Yeah. So setting the stage, I will echo some things that Dr. Harrison talked about, because veterinary medicine is not like specifically designed only to treat animals out of ethical reasons, but it has like a very, very big economic dimension, because we are responsible for food security throughout the world. And if you talk about food security, obviously a lot of economic components go into there. So lately there's been a huge economic growth in the world, and obviously people are getting richer. Or yeah, I mean, you could say that people are getting richer. So when you are richer, you obviously want to consume a lot more products like meat, milk, eggs, and other things. So that puts actually pressure on the food producing system and the food production sector that needs to account for all the economic factors of offer and demand. If you have a huge demand for meat or milk or something else, you are basically required to tend to that demand, to come up with ways so that the offer can meet those demands. And high production means that you are stressing the animals. And here I put a picture of beautiful Holstein foal. So this is the technically one of the breeds that we use to produce milk because they give like very high yields. One very good producing Holstein cow can produce up to 35, 40 liters of milk a day. And when you come to like produce such levels, obviously you are more prone to disease, which is very common in those breeds, mainly mastitis of the dairy cow. And when you have mastitis, it's very, very difficult to treat. And obviously the economic loss for the farmers is insane. Like you can have very, very high losses of income because of that. Next slide, please. Yes, so just to talk a little bit more about stress, because stress has like multiple factors and it's very difficult to define because there's also an animal welfare component that comes into play. But generally speaking, specific stress factors have been linked to specific diseases. In cows, for example, the stress caused by transportation to and from farms to the slaughterhouse and other things like that. Respiratory diseases have been linked to the stress of transportation. So a common practice is actually that due to this stress, you have a loss of the quality of the meat. And as a result of that, a common practice that is being implemented is when you transport cows to the slaughterhouse, you transport them a couple, maybe 3-4 days before, so that they can get accustomed. And then when you come to the moment of slaughter, they are a little bit less stressed, meaning less prone to disease, meaning you have a better quality meat. I've talked about mastitis in dairy cows. It's caused by high level of productions and also chronic fear. Obviously, hard to define chronic fear in cows, but like some work is being done on that. And weaning calves also is very stressful, and a lot of digestive infections have been linked to that. So as we can see, like very, very various reasons why we need to talk about stress and how it factors in disease. And obviously, if you have disease, you have to treat it. Next slide, please. Yes, so this is the only slide I have about aquaculture, but antimicrobial use in aquaculture is actually very, very, very important in terms of numbers, because antibiotics are very much used in aquaculture. They're among the most used chemical agents. Fish get sick as well. They have like bacterial infections, viral infections, fungal, parasitic infections. And the problem with fish is the production systems, because you have predominantly two types of production systems that are like open production systems, in which you have like kind of a coastal area that is close to the sea, so the water comes from the sea, it's being constantly regenerated. So that's what we mean by open production systems. And it's very hard to achieve therapeutic dosage of antibiotics in open production systems because the water is being currently regenerated by the sea. So if you have, it's like you have to achieve this level or this concentration of antibiotics, but you have also to fight this huge factor that is the amount of water that you are putting antimicrobials in. And it's either you put enough, which is a lot to treat the disease that you want to treat, or you don't put enough, which leads to antimicrobial resistance. And even if you put enough, then you don't have any ways to like get back those antibiotics. It obviously goes into the sea and has consequences on the environment. There are also a couple of points here, like adjacent contamination residue. This is what I mean by the fact that we don't know what is actually into the environment that we are treating. We may think that we are treating the disease, but obviously fish take in the antimicrobials and they use it to treat the diseases that they have, but also antimicrobials in water, and water contains bacteria and other stuff that can become resistant because you're not using high enough doses. So it's a very difficult topic, and there are a lot of professionals that know what to do in those cases. The other point is very high selective pressure due to high quantities of antibiotics. Obviously, when you're using huge quantities of antibiotics, you have this high pressure of high selective pressure because you basically treat bacteria and you manage to kill some of them, but some of them eventually become resistant. And then those bacteria have basically no competition inside the environment that they're in. And they have like free reign to like multiply. And then you have a problem because next time you want to treat something, you have to change molecules. And obviously, if you do this over different or multiple times, you have super bacteria that is basically resistant to a lot of things. Next slide, please. Yes. Okay, now I'm going to talk to like what, as a profession, we have done to fight against AMR. And obviously, when we talk about this, the very first point that should come up is reducing the use of antimicrobials. And I just talk about growth promotion, and this is actually something that we as a profession we've been looking into. So less to no antibiotics for growth promotion. Some countries are making very, very big advances in that. I've read just a recent report from Spain, which is one of the biggest producers. Like they have a very huge amount of cattle, which means that they use a lot of antibiotics for growth promotion in those cattle. And recent reports have shown that in between 2016 and March of 2020, I believe, the amount of antibiotics used has decreased by 56%. And the person who did that study also did a study on the use of antimicrobials, mainly azithromycin, in hospitals due to COVID. So yeah, COVID is obviously very linked to this, and it needs also to be mentioned. The second point is no treatment of healthy animals. This is what I talked about earlier, which meaning that if you have, for example, a cow in a farm that has bacterial disease, you know that this bacterial disease is infectious, that contagious, that you can infect other cows that are in the same farm. Basically, we are trying to treat less healthy animals because, as I explained earlier, sometimes the most common practice is you treat everybody just in case they're like asymptomatic carriers and such. So we're trying to reduce the use of antimicrobials. Next slide. These are two maps that are pretty old, 2010 and 2016. Basically, there's a level of usage of antimicrobials that is recommended by the OIE, like WHO as well. WHO has a lot of numbers on the correct use of antimicrobials in livestock. And here we can see, I wanted to include these because we can see that in between 2010 and 2016, basically nothing much, like nothing very significant has happened. And I think it's due to one very important reason, is that in 2016, there's been like this huge moment of conscience about antimicrobials that started, I think, with the what the UN did and the high-level commission on fighting antimicrobial resistance. They like, there's also the UN resolution about that. So I just wanted to say that sometimes like we still have a very big chunk of work to do, basically. Next slide, please. Yes, I'm going to run through these points. Basically, the treatment approach for dangerous zoonotic diseases. I will talk about tuberculosis because it is a very important subject in veterinary medicine. In human medicine, I believe the treatment for tuberculosis is always like very long, and it can go into months. In veterinary medicine, it's not justified for a couple of reasons. The first and most important of which is the first and most important of which is humans can get tuberculosis from consuming not cooked enough beef, or from drinking milk from a cow that has a mastitis due to tuberculosis. So we don't treat tuberculosis in veterinary medicine because of that reason, because actually bovines can get infected with human tuberculosis, Mycobacterium tuberculosis, but the cow bacteria can infect humans. So this is just a fail-safe. We don't treat tuberculosis in veterinary medicine, because if we do treat it, and by any, like, if there is any type of resistance, then it becomes a lot harder to treat it in humans. The second, the second point about this is treatment in cows, mainly because it's mainly cows that get tuberculosis. It's a very long treatment, and lots of antibiotics. Sometimes the results are not as significant. So from an economic standpoint, it's not justified, because cows usually they are only there, like they only bred for like a few months until you send them to the slaughterhouse. You try to keep the like for meat breeds, you try to keep them as short of a time as possible. Waste management. Veterinarians are actually very highly trained in waste management and just ecology, because we also work in pharma companies, and we do some of the work there. But also, if you work in a food processing plant or in a farm as well, you need to be able to manage all the waste that comes, because there's like a huge amount um, of byproducts that you have to get rid of. A big problem is with fecal matter. When you use antimicrobials on an animal, obviously some of it is rejected in the fecal matter. Fecal matter is used as a fertilizer. So that indirectly becomes, you have like a chain of antimicrobial resistant that like from fecal matter to the earth, to the plants that you're planting on there, to again cows, and you have residue. So in plants, a lot of residue is also rejected by just common practice. There is a some kind of work that was done by the American Veterinary Medical Association to try and get veterinarians to be more careful with how they dispose of medical waste, be it biological or chemical, or just other types of waste. And sometimes that waste can contain antimicrobials, which can also have a very negative impact on the environment, close environment sometimes, but also oceans, depending on where you actually dispose of your waste. As I said before, stress is a very important factor when it comes to using antibiotics for growth, yeah, for growth, like for helping animals grow. And there's a lot of work that's being done on animal welfare standards, because if you take care about animal welfare standards, basically the objective is to have animals be less stressed. They have a better life. They are able to display normal behavior, which means that they are less susceptible to have diseases, which means that you are less you have to treat less. There's like a lower chance that you have to treat those diseases. So in a lot of countries, animal welfare movements are gaining a lot of momentum, and they do a lot for chicken processing plants, specifically because chickens have it rough. I should say. They usually bred in very large numbers. You can have up to 10,000, even more chickens at one place. And sometimes for chickens that are just there to lay eggs, you have these like little cages that they are kept in, which is not very good from an ethical standpoint. It's good for productivity, but there is also this discussion that is being currently promoted, that animal welfare is better actually for production as well, because if an animal is very like in a good state of welfare, then you have less problems of production, because they actually produce more. Okay, I am sorry if I okay, should I just end now, because it seems that my time has elapsed? Yeah, basically just to talk about some of the actions that are being done by the OIE. I was an OIE ambassador 2 years ago. So there's a whole campaign that is being done right now. There's also a platform to try and get students more involved and there was this project of OA ambassadorship with the OAE and IVSA. So I'm sorry if I did more time than I should have. Yeah, these are just references that I used, and yeah, thank you.
No problem. Thank you so much, Mr. Amrani. So we have time for one question. What can be done to reduce the demand for animal meat to reduce antimicrobial resistance? So the person who asked this was asking about stem cell induction to produce meat-like food without harming animals. So yes, again, what can be done to reduce the demand for animal meat to reduce AMR?
Yes, very good question. It's a very big talking point recently for animal welfare activists that to display that there are like other options when it comes to producing meat. But what we need to understand is that currently those alternatives are very costly and they are incapable of supplying of responding to the very big demand that is currently demanded, like to produce enough meat for everybody. Another talking point is to think about it from a nutritional standpoint, because beef is actually one of the most highly, like, it costs a lot to produce beef, be it water, usage of land and crops, and it's very tasking on the environment because beef farms are very bad for the environment because they release a lot of methane and all that stuff. So there's another argument to be made about, like, you eat meat because you need proteins, basically. But what are some of the most effective ways to produce those proteins, and what are, like, some of the things you can eat that can provide you with all the nutrients that you need without being bad for the environment? And when you analyze it that way, then you can find that milk and eggs are very like, from a carbon footprint, they are a lot better than beef, and they have better I should, like, I want to say the word in French, but I don't know in English. Yes, it's very easier to produce proteins by producing milk and eggs than it is by producing beef. And yeah, this is basically what it is. But just to reiterate on my answer to the previous question, producing meat from stem cells and all that stuff, it, as far as I know, it cannot be done. Like, it cannot be industrialized in a way, because it needs to be industrialized. If you want to, like, have a big shift one way or the other, it needs to be industrialized, which is very hard because the conditions in which you need to produce those things are very fastidious, and it can be done so far.
So thank you so much, Mr. Amrani, for, like, really expanding our view of AMR to encompass its implications on veterinary practice. So this isn't a topic that is commonly lectured in the medical curricula of my country. So I really appreciate learning about this from you today. So
yeah, thank you so much for having me. I'm very sorry if I used more time than I had.
Yeah, no problem.
Yeah.
So we'll see Mr. Amrani again at the this Q&A session at the end of all the presentations. So now I'd like to introduce our third speaker. So we have Mr. Berkay Akad Ulker, who is currently on his 4th year as a medical student at the Istanbul University Faculty of Medicine. An active member of the European Medical Students Association, he has held numerous positions since 2017, including board assistant, medical science director, and vice president of internal affairs, to name a few. So he will be discussing the role of the environment and associated pollution in developing AMR. Let's welcome Mr. Ulker.
Hello, everyone. It's really good to see you here in this webinar. And I think so far our speakers were really good to mention some really high yield topics. And I hope that my presentation will also help you to understand the role of the environment and also some view of the European medical students and what we have done so far about antimicrobial resistance. So I think we can move on to the other slide. So the environment as a potential starting point. While the environment is about all the living and non-living things around us, soil, water, and waste from different sources are key elements of concern in the context of AMR. A common perception is that the environment is at the end of the spectrum, but this perception could be challenged. We should rethink and reprioritize, because so far, the focus has been on what is going in and not on what is coming out. It is likely that the complete picture is missing. A picture where in one part, the environment is potentially more relevant than the others. This is because the environment is a big pool of AMR determinants, and which are such as antibiotic-resistant bacteria, antibiotic resistance genes, and antibiotic residues, wherein continuous and perhaps the everlasting interplay among these determinants potentially sets the ground for resistance growing like a chain reaction. So we can move on to the other one. So how does WASH contribute to the AMR? Water sanitation, hygiene, and wastewater factors play a role in the environmental dispersal and transmission of AMR in 3 main ways. First is dispersal via water, sludge, and manure, potentially resulting in the transmission of disease-causing pathogens to humans, animals, and plants. So what is important here is, each year, hundreds of millions of cases of diarrhea in humans treated with antimicrobials, and universal access to WASH could reduce this by 60%, which is a great number, and which shows the importance of WASH here. Secondly, silent transmission of resistant microorganisms with low pathogenicity that only become evident when they infect particularly vulnerable populations or their genes are transferred to pathogens causing infection. So, talking about numbers, 14% of people globally carry E. coli in their feces that produce extended spectrum beta-lactamase enzymes, which provide resistance to antibiotics such as penicillins, cephalosporins, cefamycins, and to some extent carbapenems. And thirdly, release of fecal and other pollutants, including antimicrobial compounds into the environment, may promote resistance by creating conditions favorable to the transfer or emergence of new resistance genes. So we can move on to the other slide to see some diagrams about this one. So as you can see here, there's a diagram on how environment and WASH can affect the antimicrobial resistance. As you can see, up to 80% of antimicrobial dose administered can be excreted as the active compound or metabolites, depending on the class of antimicrobial and how it is used, and wastewater treatment is often insufficient or not possible. Similarly, antimicrobials in water downstream of some antimicrobial manufacturing sites, as you can see in the image, have been found at concentrations higher than the blood of the patients taking medicines. Also, as you can see on the right, which is a thing that actually we're not concerning that much, is the animal and plant production. The use of antimicrobials in terrestrial and aquatic animals, as mentioned in the last presentation, and plants can also contribute to the spread of antimicrobial compounds and their metabolites, and also clinically relevant antimicrobial resistant genes, and etc. So we can continue to the other one. Yeah, so here you can see some factors on the impact of antimicrobial resistance. So the main factors are humans, terrestrial and aquatic animals, food and feed, plants and crops, environment, and water sanitation and hygiene. So I think the most important ones are here, for example, humans. So what is the importance? The misuse and overuse of antimicrobials, poor access to quality and affordable medicines, vaccines and diagnostics, and also lack of awareness and knowledge with the population movement. Talking about the environment itself, which is the main topic of this presentation, is the importance here is discharge of waste from healthcare facilities, pharmaceutical manufacturing, and farms. And again, talking about food and feed, poor infection and disease prevention and control, transmission of resistant pathogens in food production, storage, and distribution and preparation is really important. But last, but most importantly here is the water sanitation and hygiene. Lack of access to clean water, sanitation and hygiene, poor infection and disease prevention and control in healthcare facilities and farms are really important for the impact of antimicrobial resistance. And talking about the impacts, we have three important things here. First, risks to food and feed production, businesses and trade, and interaction with climate change. Second, increased morbidity and mortality in humans and animals. And thirdly, the economic damage, loss of productivity, and increased healthcare expenditures. As you can see here, these wash and wastewater barriers therefore need to be included in plans and strategies to combat AMR as part of a comprehensive approach to addressing multiple drivers of AMR. So we can move on to how we can tackle the AMR from the environment, from policies to practice. As you can see here, actually, policy making is an important part of EMSA that we are actually caring about. And we think that all the policies have their own basic ideas, and the ideas can collaborate to the best idea if they're used wisely. So on the other hand, despite limited global guidance on that, the countries, though at varying degrees, have outlined their approach to address the environmental side of AMR in their national action plans. While this is encouraging and reflects willingness of a country to own up the problem, but without global guidance, it may result in inadequate on-the-ground response, which also not be uniform across national boundaries. A comprehensive approach is required to address this complex issue. The precautionary principles should be adopted, and ongoing research should inform future policy and plans. Also, it is important to understand the resources, capacity, and infrastructure for environmental AMR surveillance and the enforcement of policies. So there comes the One Health approach, which is important in the next slide. So a One Health approach should be taken to minimizing environmental contamination with antimicrobial residues and antimicrobial bacteria and genes. In the European Union, a greater volume of antimicrobials is sold to treat diseases in animal husbandry than for use in the human medicine, which is a huge environmental problem. The WHO Global Action Plan on AMR, which was in 2015, I'm referring to, includes the environment in the One Health approach. The development of strategies to minimize environmental contamination by antimicrobials and resistant bacteria is also one of the priorities of the One Health approach, and I think that will be mentioned with next presentations in the future of this webinar. And then we can move on about the risk management. So, risk management measures to be applied in general to limit environmental contamination by antimicrobial residues and again, antimicrobial resistant genes. From a public and animal health perspective, it is a priority to use antimicrobials in an optimal way to treat the disease effectively, but also reduce any unnecessary consumption of antimicrobials and their subsequent release into the environment. In conclusion, the field of environmental AMR is a rapidly changing and evolving scientific discipline, and new insights and findings are published almost weekly. So I know that Actually, the scientific measures are really important. And while I was the medical science director for EMSA, we worked on antimicrobial resistance too much, and we also had our own awareness campaigns, but also we tried to create awareness on the medical students in Europe because we already have the issue of the prescription of the antibiotics. So in the next part, I'll be talking about what EMSA does about the AMR. So as you can see here, this is the renewed policy paper by the European Medical Students Association. The first initiative was taken back in 2017, and our policies are valid for 3 years. So this policy is just renewed in October 2020, and it will be valid until October 2023. Also, I just want to mention that EMSA represents medical students across Europe, and we envision a healthy and solidary Europe in which medical students actively promote health. Also, EMSA empowers medical students to advocate health in all policies, excellence in medical research, and also interprofessional healthcare education with the protection of human rights across Europe. So we can move on. So here I'll be talking about EMSA's perspective regarding the AMR. The EMSA recognizes the need of multi-sectoral efforts against AMR, aiming to judicious antimicrobial use in the healthcare and outpatient sector. Like this webinar is a great opportunity to support that, because we are here from multi-sectors talking about the same issue and trying to solve the same issue. And as you can remember, while we are making the policies, actually, this is the part we are missing. All of the professions should be together, working on the same thing together, and they should create the awareness, which brings us to the next point, the raise of public awareness about AMR and antibiotic use. And also next, the research and development of new antibiotics is again recognized by EMSA, and we give high importance to this section. And again, a One Health approach should be followed, should be agreed, and also should be prioritized in every policy. Then we can move on. And also, representing medical students from all over Europe, EMSA highlights the necessity of a comprehensive healthcare workforce training on both AMR awareness and antibiotic use. Again, I think these opportunities are really great to make people realize that we're not alone in our professions, whether you're from the medical field, pharmaceutical field, or the veterinary field. This is a common fight that we should be seeking for. We should seek for help, and also scientifically, always the interprofessional collaboration should be followed. And there comes the EMSA commits to part. EMSA commits to continue tackling AMR issues in the future, supporting the international collaborations like this webinar, and strengthening its faculty member organizations with specific AMR events, and also the policy-making processes while we are involving all of our members and engaging them appropriately in order to take action against antimicrobial resistance. To end my words, I believe that we're still really far away from the point that we began about the AMR. And I've seen that lots of students from lots of different fields are giving the awareness to the antimicrobial resistance, and just talking about environment and the other specifics is really important to know that we will be tackling with this issue in the future more, and therefore we're right now gaining the experience to do something in the future while we are actually the healthcare professionals and when we are actually the ones who can change the world. So we can move on to the references. So as you can see, here are the references that I used for this presentation as a research content. And we can move on to the next one. And thank you very much for listening to me. And I hope that this presentation was a fruitful one for all of you. You can reach to the email accounts that I've just written here, and also you can see our websites and social media accounts for any questions regarding AMR, and also for any collaborations regarding AMR or any scientific issues. You can always reach to us, and I'll be happy to answer your questions now. Thank you very much for listening to me.
Thank you so much, Mr. Ulker. So we have a question from the audience. What specific projects did EMSA hold to fight against AMR?
Okay, so in the past, we try to create the awareness for the future healthcare professionals, which are the doctors in EMSA's situation, and we have our faculty member organizations. So we created specific World Antibiotic Awareness Week events in those situations, and our medical students try to create awareness with webinars again and conferences in their schools where there were no COVID-19, of course, and they created the awareness in their schools. But also, we took the initiative to have awareness campaigns on social media within the collaboration with European Center for the Disease Control and also WHO Europe Regional Directorship. And also, we have been collaborating with the faculty members to actually have awareness campaigns on the field. For example, let's say that in a crowded city or in a crowded town, our faculty members created their special stands and they actually informed normal people, the public, about their public health regarding antimicrobial resistance. And even there were some surveys regarding that. So would you use antibiotics even though you don't need it, and etc. And we actually seeked how we can develop something to the public as the future doctors. So that's I think in summary what we have done in the past, but I believe that this year also we have achieved really too much stuff, and this will be also reported in the future.
Thank you so much for that. There's maybe just as a follow-up question to the initiatives of EMSA, somebody's asking if you have any tips on how to campaign for AMR the right way to people who don't care about global health.
Okay, so I think that has been an issue for all the awareness campaigns and also all the advocates of medical science and also public health. The problem is we shouldn't tackle people because they don't know something or they don't care something, but we should actually sell our ideas and make them care about it. It's like actually selling a product. If you make them care about it, if you make them see that it's actually an important issue and it's a thing that they can change their lives, again, I think that's the way to do it. As was mentioned before in the other presentations, saying that people actually should be caring about it and maybe making them talk with a person who already got an infection, which was antimicrobial resistant, and make them realize the how problematic is this situation. People tend to not realize the stuff that they're not actually experiencing, but they also tend to empathize with the people if they see someone actually going through something and if they can be familiar with the issue. So I think what EMSA did last year was to make people familiarize with the issue, and we created social media campaigns, which I think everyone is using social media, and lots of percentages using it. So if you use that and if you create your visual identity and have your visibility as an organization, then people would realize that. And also the external affairs is really important. Your external affairs as an organization should be advocating your ideas, and also within the content, I think there should be a balance and a great connection with your internal events and also the external events, and they should always work together to maintain the representation and also the quality of content. And actually they all give feedback to each other and they're very contacted.
So thank you so much, Mr. Ulker, for talking about the environmental implications of AMR, which really aligns with the One Health approach and calls for multi-sectoral efforts given all the different stakeholders involved. And also thank you for sharing your advice on how we can better run campaigns and initiatives on the fight against AMR. So we'll be hearing more from Mr. Ulker at the end of everybody's sessions. So thank you.
You're welcome. Thank you.
I'll be introducing our next speaker. So we have Dr. Shamsuddin Aliyu. So Dr. Shamsuddin Aliyu is a consultant medical microbiologist and lecturer at the Department of Medical Microbiology of the Ahmadu Bello University in Nigeria. So he specializes in medical bacteriology with specific focus on antimicrobial resistance, bacterial genomics, and bioinformatics. So today he will be discussing the role of medicine, the impact of misuse or overuse of antimicrobials on AMR. So let's welcome Dr. Aliu. Sir, you're muted. Oh, there.
Okay, yeah.
Good.
So good afternoon and or good evening, depending on where you are. Thank you very much for that introduction. I think I'm honored to have been chosen to be one of the speakers for today's presentation, and I'll try to do my best to see that I make sense of the topic so that people can go away having learned something. So thank you very much. Next slide. Yeah, so I'll be using this outline. I'll first start by talking about antimicrobial resistance. Briefly, the concept of One Health, the misuse and overuse of antibiotics, factors responsible for abuse of over-the-counter medications, especially antibiotics in this case, and then how to prevent this, misuse or overuse, and then our conclusion. Next slide. Yeah, so let me say that my work has actually been made easier by the presentations by the first three speakers. Very excellent presentations. So I think many of the concepts I intend to discuss have already been mentioned. So I think that's quite good. As we all know, it goes without saying that antimicrobial resistance is really a global health problem. WHO actually recognizes that as one of the greatest challenges to humans, moving forward. And there's a lot that has to be done to counteract antimicrobial resistance. Misuse and overuse of antimicrobials are the main drivers of development of drug-resistant pathogens. But I have to say there are many factors that are responsible for pathogens becoming resistant. But what we have seen is that misuse and overuse, is actually one of the main drivers, of antimicrobial resistance. The concept of One Health, which has been discussed by the previous speakers excellently, focuses on issues impacting on humans, livestock, wildlife, and the environment, which has been highlighted by the previous speaker. The environment is really key because a lot of the things actually start in the environment. So addressing that issue has been of great importance. We really need to take urgent steps, to curb the scourge of AMR. And that's why I'm happy, this Awareness Week by WHO, which, you have taken up to see how you can enlighten your members. And I think that is quite good. Next slide. Yes. So briefly, we all know what antimicrobials are. There's antivirals, antifungals, and antiparasitics. Antibiotics, which refer to, naturally occurring substances that we use against bacteria. So antimicrobials, span across all pathogens, but over time, people have really been focusing on the antibacterial agents, whether it be the synthetic, the semi-synthetic, or the naturally occurring ones, which we actually refer to as antibiotics. And, the problem with antimicrobial resistance is that, over time, pathogens that we treated with antibiotics that are readily available, over time, we tend to lose this advantage and we are not able to treat these infections, with these commonly available antibiotics. And then we now have to move to newer and newer, more expensive antibiotics. And eventually what is happening is that we're running out of antibiotics to use. And then that's because people are not developing antibiotics as quickly as they should. Of course, the cost of producing antibiotics is so much that for a lot of pharmaceutical companies, it's easier to focus on other things that, that will make them more money. And then, you develop an antibacterial agent today, and then in a month's time or in 2 months' time or 3 months' time, the bacteria have already developed resistance to this antibiotic. So it's a real problem. World Bank estimates that AMR could independently result in global fall in GDP. You can imagine, a global affectation of the GDP, 1.1 to about 4%, by 2050. That is tremendous. Even wars affecting large regions may not affect the GDP as much as this is. So this is really a huge problem. And in the hospital setting, we have, when pathogens are resistant, people stay longer in the hospitals because you're trying to decide what antibiotics to use to treat the infection. They spend more, more complications, and of course, increased mortality, which is what, it ultimately results in. Next slide. Yeah, so this has been highlighted by the previous speaker. So I think I will not dwell much on it, but just to show you the estimated global death, by 2050 in the different regions. And you can see the hard hit regions are the, Africa as well as Asia. Next slide. Yes, and this also, just highlights how resistance develops. So you have a group of pathogens, and this is where misuse and abuse of antibiotics really comes into play. So you are supposed to use antibiotics, for instance, for maybe 5 days. You end up using it for a day. So if within the population of pathogens that are affecting you, or in this situation, you use the antibiotic for a day, what happens is that you don't kill all the pathogens. It's not enough time to kill all the pathogens maybe within the lungs. And what happens is that a few of them will survive and haven't been exposed to the antibiotics, they develop resistance. So you didn't kill them outrightly, but you kind of exposed them to it. So the pathogens will say, this is good. I now know what he intends to hit us with. Thank God he has not been able to the antibiotics did not kill us. So we'll be ready, next time when he hits us with antibiotics. So a few of the pathogens, become resistant within that population. And then this is now spread from one person to the other. And this is how the resistance spreads. Next slide. Yes, and this just is to show us how bacteria, I'm focusing a lot on bacteria because, of course, antimicrobial resistance cuts across all antimicrobials, but the focus a lot has been on, antibacterial agents because of the burden, the amount that we use globally. And then, of course, the burden of bacterial infections is really much globally. Yeah, so essentially for bacteria, this is just to recap, the microbiology of antimicrobial resistance or resistance to, antibacterial agents. Essentially, the pathogen, the bacteria can do one of two things, develop an enzyme to degrade the antibiotics. Sometimes they have efflux mechanisms, they just push out the antibiotics. Sometimes they make the cell wall impermeable, to antibiotics, so the antibiotics cannot enter into the bacterial cell. Occasionally, they alter the target. So where the antibiotic is supposed to act is now altered. And what that means is that, the antibiotic will not be able to act, on that target. And then lastly, they also release enzymes. These are very common mechanisms of resistance for bacterial pathogens. They release enzymes that degrade the antibiotics, and then so the antibiotics just become useless. Next slide. Yeah, so what are those factors responsible for spread of antimicrobial resistance? Misuse, one, lack of clean water, sanitation, hygiene, wash, which has been mentioned earlier, poor infection and disease prevention and control in healthcare settings, and of course, within the agricultural setting. poor access to affordable medicines, vaccines, and logistics, lack of awareness and knowledge. So people just don't know. And I think this is why such awareness campaigns are very, very important. And then, of course, lack of enforcement and legislation. I'm going to dwell more into that during, the presentation. But it's a huge problem, especially in developed countries. In developing countries, you have no enforcement of legislation. So people just do whatever they want to do. But as you can see, the misuse and overuse is really a huge problem. Next slide. Yeah. So again, WHO has identified, more or less saying the same thing, over prescribing of antibiotics as a big problem. We just prescribe antibiotics for things that we don't need to, and then patient not finishing, of course, so this is from the patient now, not taking the antibiotics as they should. Overuse of antibiotics in, agriculture, of course, poor infection control in the hospital, lack of hygiene and all that, and then lack of new antibiotics, which have not been, we were not developing antibiotics. Next slide. So this is an interesting diagram, and I think it highlights the multifaceted problem of antimicrobial resistance. As you can see, to the right of this, this depicts usage of antibiotics, and this depicts, resistance, the burden of antimicrobial, antibacterial resistance in this case. And as you can see, when you move towards the right, more antibiotic use. So you can see that in Middle East, the Middle Eastern regions and Africa, we have Europe and then Central Asia. You have a huge amount of antibiotics. You have huge amount of antibiotics being used. The actual usage is high, especially in Middle East and Africa. But interestingly, if you look at this, the burden of resistance is actually higher, in countries in the South Asia region. So they use less antibiotics, but the burden is higher. These countries use more antibiotics, the ones to the right, but you can see the burden is higher. So it's not just about the burden, the amount of antibiotics you are using or misusing or, abusing, but what this tells you is that it's a multifaceted problem that we have to look, with that, and this is where the One Health concept comes in. There are so many factors that we have to address to actually tackle the problem. Next slide. Yes. So the concept of One Health has already been discussed. It just implies designing, implementing policies, legislation, and research in which multiple sectors come together, with the goal of achieving, better public health outcomes for everybody. But of course, the main focus is actually the health of humans, but we know that we cannot look at the health of humans alone, that we have to look at the health of animals, the environmental health, and so many other factors. So this is what One Health, tries to look at. A lot has been said about it, so I will not dwell on it, but just to say that it approaches AMR, the focus is primarily on reduction of antibiotic use, in food animals, apart from looking at the burden in the environment and things like that. Next slide. Yeah, so this is just a diagram depicting the One Health concept, which you can see is, people communicating, coordinating, collaborating, from different regions with the sole aim of improving the health of everybody. Next slide. So what is this misuse? Abuse or overuse, which we can refer to as abuse, whether or misuse or overuse. So this refers to the misuse or overuse of antibiotics with potentially serious effects. One of them is antimicrobial resistance. They are releasing, antibiotics into the environment. The bacteria are not killed, but because they're exposed to it, they become resistant, and then these pathogens now end up, in us, and then creates this vicious cycle which continues. And it's interesting that about 2 tons of antibiotics are used around the world every 10 minutes. I mean, just think about it, 2 tons every 10 minutes. This is the amount of antibacterial agents that we use. And all too often without any prescription of control, especially in developing developing countries. People just go and buy these antibiotics. So we have a lot of antibiotic usage that is actually not needed. And that is a very huge problem. Of course, and this is now speeding, the process of antimicrobial or development of antimicrobial resistance. So it's actually, quite a huge problem. Next slide. Yes. So why do we have this abuse of, misuse of antibiotics? There are many factors. First of all, it's more a problem in developing countries due to poor regulation. So abuse of over-the-counter medications. Poor regulation means that people just go and buy whatever they want to buy. In many countries, in the many developed countries, you just don't buy any antibiotic. But in developing countries, you can virtually buy any antibiotic from, a pharmacist, or virtually any antibiotic you can buy. So imagine a carbapenem or colistin, if it's available, you just go and tell the pharmacist, I want, or these people who are selling these drugs. And in many instances, they are not pharmacists. They're just people who open up shops and they believe they can, sell antibiotics. And they do actually in many developing countries. So they are purchased without prescription. One problem in developing countries is that some of these medications are not available in government hospitals. So people usually just prefer to go outside and there they buy anything. And then of course we have a lot of quacks. And when I say quacks, I'm talking about people who are not healthcare professionals. And these people are, just, selling antibiotics. They have no knowledge about the dosaging, about side effects, indications, contraindications. They just sell antibiotics. And many of them feel, I can do it. After all, what does it take? Someone has a fever. You just throw in an antibiotic, amoxicillin, for instance. He'll get better. And of course, one of the problems you have, especially in developing countries, many of these, vendors actually sell expired or substandard drugs. So they don't care where they get the drugs as long as they're cheap. They put them and they sell them for as long as they can sell them. They really don't care about, the issue of whether they expired or not. So that's a huge problem. Next slide. Yeah. So we have antibiotic misuse in different sectors. We have it in the healthcare setting. In clinical practice, we actually have a lot of misuse of antibiotics. Misuse by unskilled practitioners, which I talked about a little. Misuse of antibiotics by the public. When I say antibiotics here, I'm talking about antibacterial agents, and then misuse in agriculture. Of course, as mentioned by one of the speakers, we have to do away with using antibiotics in agriculture, but many countries it is still used, and something that actually we should do something about. Next slide. So in the healthcare, so when we look at unskilled practitioners, yes, we have many of them, in developing countries especially, people who are unskilled and selling antibiotics, and many patients are actually treated by them, unfortunately. And this may be because, well, it's not an excuse, but in certain parts of developing countries, people just don't have access to good health care. If you go to the rural areas, the villages, for instance, people just do not have access to, healthcare personnel. So these guys are there, claiming to be healthcare experts and selling people anything. So that's a problem. Of course, they are really unaware of the side effects and contraindications, which I mentioned is a problem. These unskilled practitioners, they offer cheap and often expired drugs. And unfortunately, this practice is further supported by the self-prescription. Yeah, people have a fever, they feel, I know what's wrong with me, just malaria, or maybe it's typhoid fever. So let me just go to these vendors and then ask for treatments, So self-prescription is also a huge problem that we should advise, people against. And then, of course, some of these vendors are just motivated by greed. I just want to sell as much antibiotics, make as much money. Antibiotics are popular because people are always coming down with fever. So I'll just sell them, to as many people as I can, make as much money, even if they're expired. I don't care. I just want to sell these drugs. Next slide. Yes. In the clinical practice, also very important, in our hospitals, we have misuse, by healthcare practitioners, unjustified prescription. We know that most common colds are caused by viruses, but yet someone presents with a common cold. In some instances, people give antibacterial agents, which will actually not do anything. And that is because, well, people are just, the healthcare practitioners are just not using, current guidelines. They are not updating their knowledge, which is very important. Under prescription, it's also a huge problem. Not using antibiotics for the appropriate duration, so it's something that doctors need to do. Inappropriate duration, under dosaging, what I was referring to is that not giving the appropriate dosaging. So you're giving under, you're supposed to give a patient 1 gram 8 hourly of a particular antibiotic, you end up giving 500 milligrams 8 hourly. That will not kill the pathogen, but it will expose it, allowing it to become resistant. Then inappropriate duration. Most antibiotics, depending on the infection, are supposed to be used for a certain duration. People sometimes do not adhere to that, so they now give it for a shorter duration, which also is a problem. In the healthcare setting, antimicrobial stewardship is very important. Unfortunately, most hospitals are struggling to implement antimicrobial stewardship. So it's a problem. People are not aware, healthcare professionals are not aware, are not updating themselves. So it can be a problem. We actually need to encourage hospitals, healthcare professionals to improve their knowledge of antimicrobial stewardship. So when do I use a broad spectrum antibiotic? When do I use a narrow spectrum or an expanded spectrum antibiotic? And then we also have the unfortunate situation where drug suppliers and companies induce doctors to use particular drugs. Of course, this is unethical, but it does happen in certain regions of the world. So someone has an infection, that this antibiotic is superior to the other, but then because the drug supplier is promising to give you certain incentives if you use his own antibiotic, despite it being inferior, you go ahead, so that in the end you end up getting some financial inducements, settlement, which I think is quite unfortunate. Next slide. So what are some of the factors responsible for abuse of over-the-counter medications? Self-care and self-medication, I already mentioned it. Poor healthcare systems, poverty, lack of adequate knowledge, both in terms of the healthcare practitioner, in terms of the patients, and others. Ignorance, people just don't care. They don't want to know. They don't know and they don't care about knowing. But I think this is where the medical students associations can come in. They can encourage people, they can encourage campaigns, enlightenment campaigns, so that the public is made aware of some of these challenges, especially in developing countries. I think these are very important. Of course, poor regulation is such a huge problem. I can just decide to set up a shop, and someone, sorry, not me, I'm a healthcare practitioner, but anybody can set up a shop and then start selling antibiotics. And it's interesting to say that we actually do have regulations in many instances to prevent that, but there's poor enforcement of these regulations. Next slide. So how do we prevent this? For healthcare practitioners, prevent overuse or misuse, and change of attitude, improve your knowledge, use guidelines, update yourself on recent guidelines so that you treat patients based on new. Knowledge is always improving and you need to really update your knowledge. Again, report antibiotic resistant infections to surveillance teams. Setting up surveillance systems in hospitals is very important. It's more difficult if you want to incorporate surveillance from within the community, where you have people prescribing antibiotics. You have also labs, quack labs, also giving out, fake antimicrobial, results, antimicrobial susceptibility test results. So we need to have systems that allows, surveillance team systems. We need to have surveillance systems that look at these problems to identify when we have pathogens that are resistant, and within the community, within the hospital. And then talking to patients about how to take antibiotics correctly is very important. Antibiotic resistance and, misuse. As medical students, to talk to your patients. And just a minute or two about the importance of taking the antibiotics for long enough. I know even many of you as medical students, you take antibiotics once you feel better, after the setting, not to talk about patients. Next slide. Next slide. Yes. Then for individuals, for the communities, no, can you go back? Yes. So for people, individuals in the community, we should champion that people should use certified healthcare professionals. We should encourage people not to just request antibiotics from healthcare workers. I've had instances where someone calls me up and say, I have a cold, can you just prescribe antibiotics for me? Antibacterial agents for me. We have to discourage that. We should we should encourage people to follow the advice given by healthcare workers. People should not, so you encourage people not to use antibiotics simply because your brother used an antibiotic and there's some left over. You just say, I have a similar condition, so let me just take the antibiotics and use it. And then of course using encouraging people who are into agriculture, encouraging them not to use antibiotics in food production. It's very common in developing countries, very poor regulation. People just buy antibiotics anywhere and just give it to animals, to make the animals grow, bigger and healthier. Next slide. Yeah, so for policymakers, and again, our associations need to come in, encourage governments to, you have a lot of advocacy power. So encourage governments to do the right thing. Encourage governments to have national policies to tackle antimicrobial resistance. Play a role in developing these policies, either as students or even as medical practitioners. As students, we have a lot of influence, we have a lot of power. If a single person can change global policy, then what of a federation of medical students from all from all over the world, so we have to have policies that promote the use and disposal of quality medicines. So how do we dispose, appropriate use and then disposal? Some hospitals don't dispose their drugs, expired antibiotics properly, so they end up in the hands of these quacks. Ensure that adequate resources to enforce the policies and to impose penalties. In many places you don't have penalties, so you're caught selling drugs and you are not a healthcare practitioner. Nothing happens to you. Maybe you may be taken to jail, maybe for a few hours, and that is if that happens. But after then you are released, and then you go and do the same thing tomorrow. And make information available, to policymakers on the impact of antimicrobial resistance. Next slide, because many of the policymakers actually do not know. Next slide. So in conclusion, I will say that it goes without saying that AMR is one of the top 10 threats to global health in global health. It's a very big problem. Irrational use of antimicrobials is a complex and multifactorial problem. It may interest you to know, studies have shown in the United States, 30% of antibacterials that are prescribed to patients are actually not needed. So this is the United States, where policies are there, guidelines are there, enforcement regulations are all there, but yet, inappropriate use almost 30% within the healthcare setting. I mean, that's really frightening. A multi-sectoral efforts needs to be used to tackle this abuse. And I think it's good that you have farmers association of pharmaceutical students, vet medical students, human medicine, and others coming together to encourage, to improve awareness on the issue of antimicrobial agent. We need multi-sectoral effort. No one group or entity can do it. And of course, we need to also employ new techniques, get knowledge about, new avenues of, investigating antimicrobial resistance and getting solutions to the problem. New innovative methods such as metagenomics, where we're looking at, using whole genome sequencing to actually look at the burden of resistance within the environment, within sewage water, and all that. So, and then of course, big data, use of big data, analysis of big data. We need to actually harness the use of, harness data from many sources, and then be able to analyze this data so that we end up with, this helps us to identify the problem, and may also offer solutions, to these problems. As you can see, if we don't act, and we don't act now, the consequences, will be severe, not only to us, but to our loved ones, to everybody in the world. So next slide. So these are my references. Next slide. Yes, and I think that's the end. I hope you really enjoyed this talk, and I'm looking forward to answering your questions. Thank you very much.
So thank you so much, Dr. Aliu. So for our questions, somebody is asking, what is the current status on production of new antibiotics?
Yes, so on the current status, unfortunately, it's not very good for the reasons that I mentioned. The cost, the cost is so much. You develop the identifying agent, you now go ahead to use it, maybe go through clinical trials, phase 1 to phase 4, and then market it and all that. And so it's not very good, although there are still some companies that are into, developing new antibiotics, simply because a lot of the antibiotics that we have, the bacteria or pathogens are becoming resistant. So people are looking for new innovative methods to fight bacteria or other pathogens. And so there are still companies that are doing so, because if you can actually develop a new antibiotic that can be used for a year or 2 or 3, there's money to be made. So although it's not encouraging, the amount of antibiotics being developed has just been dropping, and it's still going down. Where you had many years ago, you don't have the amount of new antibiotics being produced many years ago, you don't have now. So the curve is actually going down, but we still have some people that are trying to develop new antibiotics using new innovative methods. Thank you.
Thank you so much, Dr. Aliu. Unfortunately, due to the time constraint, we can only ask you one question. But the audience, to the audience, you'll be seeing Dr. Aliu again at the end of everyone's presentations. So thank you so much, Doc, for elucidating the different types of antibiotic misuse. So among the public, agriculture, and even in the clinical setting. I loved how you so comprehensively discussed a multi-pronged solution that spans across multiple stakeholders, healthcare professionals, the general public, and policymakers, all for the prevention of AMR. Thank you.
Thank you.
Now we'll be proceeding with the next presentation. I'll be introducing our 5th speaker. So we have Dr. Ajidahun Olusina Michael, popularly known as the Bearded Dr. Sina on social media. He is an award-winning doctor and the ambassador of Dosai Healthcare. He's the regional director in Nigeria for Hope for Us charity, and he graduated with an MBBS degree from the University of Ibadan in Nigeria. He's interested in research, entertainment, health awareness and promotion, and photography. Let's welcome Dr. Aji Dahut.
All right, good afternoon, everybody. I don't know if I'm okay. Good afternoon. I don't know if you can all hear me.
It's clear, yes, we can hear you.
Okay, all right. Okay. So I'll be talking about the role of medicine and the impact it has had on health services on antimicrobial resistance. Well, I think my work has been simplified. All the speakers have done a very, very great job. So I'm just going to be talking about the social aspect of this. Okay, next slide. All right. We'd all agree that antimicrobial resistance is an emerging problem which the world is currently facing. I mean, all the figures have been given, and it's alarming what is really going on concerning antimicrobial resistance. And it's a known fact that organisms exhibit resistance to drug by various mechanisms. Dr. Aliyu has done a very, very great job explaining the various mechanisms that organisms, use to develop resistance to these drugs. But we also have to know that some of these are also man-made. All right, next slide. Okay, now one of the factors that has caused an increase in antimicrobial resistance, you don't agree with me, is one, misuse of antibiotics and unregulated use of over-the-counter medications. Now, this is the 21st century, and every patient is now a Google doctor. Once you have any symptoms, you have Google. Okay, I've got a headache. I'm sneezing. Okay, Google, what do I do? You'll see tons of messages of, oh, take this, take that, and all that. And with the advent of what we call chemists in this part of the world, they just go there, get a prescription, and all these are not regulated. And even the pharmacist or whoever is dispensing drugs don't even want to verify and all that. And that has also increased the incidence of antimicrobial resistance, so over-the-counter prescription. Next slide. And in using the African setting as an example, there's a burden, and Dr. Ali gave us the figures, there's a burden of antimicrobial resistance. And sadly, a lot of these people don't even make it to the hospital. Now, a lot of them die, and they form part of the quota of the people we say that died from an unknown illness, because these are people that you've tried every antibiotic, it's not working. And at the end of the day, the patient succumbs to death. Now, what the public will be made to believe is that, oh, this person died of an unknown illness, but actually this person could have died from a virulent strain of an organism that was resistant to most of the antibiotics that were available. Okay, next slide. Okay, and the brunt of today's discussion is how has the healthcare system also affected antimicrobial resistance. Now, the first thing is we know that the hospital is a place where patients are admitted. We have varying type of patients and all that. And in developing countries, the hospital is seen as a last resort. Now, when a patient has had all these illnesses, they've tried treating, that is when they present to the hospital because their symptoms are not resolving. So we both agree that the hospital setting, it's a place where you will find a lot of antimicrobial resistance based on the factor I just said. And also in the hospital, for example, in developing countries, there's proximity of closeness of patient in wards. And Dr. Aliyu mentioned earlier some ways the organisms can be transmitted with no contact, airborne, and all that. These are ways and all that organisms can be transmitted. And when you have a lot of these patients in the hospital itself can offer a means by which these infections can be spread, taken in quote, if the hospital does not observe standard precautions. I'll still come to that shortly. Okay, next slide. Okay, and one thing is we know that the hospital environment is a very, very peculiar one. Why? The organisms that you find in the hospital are different from the organisms you will find in the community. For example, let's say a condition like pneumonia. That's why we have a condition like community-acquired pneumonia, and we know, okay, in community-acquired pneumonia, the organism you probably be thinking of, say, staph aureus and those common organisms. Now, when you're talking about a pneumonia which is acquired in the hospital setting, well, staph aureus might not come very high there. Now, because the risk factors for this kind of patients, maybe patients on ventilators, patients for all that, and you would be talking about more virulent organisms like Klebsiella, Pseudomonas, and all those things. So we can establish this fact that the hospital set environment, it's one that is plagued with a lot of resistant organisms naturally. And now when we now have multi-drug resistant to already virulent organisms, I mean, what are the chances? And like I said earlier, it's very, very important because this is going to guide the latter part of this slide, is that the hospital organisms usually are very different from the organisms we have in the community. Okay, next slide. So what are the factors that are really contributing to the increasing of antimicrobial resistance? Now, the first thing is overpopulation. Now, I'm in one of the developing countries, so I'll be using my own country as a prototype. I mean, I know the picture over there, but since I'm here and I practice it, I'll be sharing some of our experiences. What is overpopulation? Now, most hospitals and most healthcare centers in this part of in developing countries are usually overpopulated. Now, there are standard guidelines for how many beds should be in a hospital in wards. And okay, if this is the meter or area of this room, you're expected to have this bed. But now, because you're having people wanting to maximize profit and all that, you have the beds choked up together. Now, imagine you have a patient that has a multi-drug resistant organism because it's just been coming from the community where it's taking a lot of medication and now it's so sick. And now you have another patient that is not obviously very sick like that patient. Because of close proximity, you can have organisms getting from one patient to another. Now, the second reason, again, another factor is failure to observe precautions. Now, you have a lot of healthcare workers that don't observe standard precautions as highlighted by the World Health Organization. We know that for sure. One thing is we treat every patient as if they are infected, hand washing, use of gloves, use of personal protective equipment, and all of that. Sometimes all these are not used, and all these also have aggravated the spread and worsening of this antimicrobial resistance because these organisms will always be there. Another one is the lack of adequate testing before commencing antibiotic. Now, usually, most times in most hospitals and healthcare system, now when a patient comes, standard samples are not taken. Now, when a patient comes, you should take blood culture, urine microscope samples for urine, microscopy, culture and sensitivity, and other samples should actually be taken before you start a patient on antibiotic. But what the picture you find now is that once a patient comes, most times, because people are not enlightened, you can just say, oh, just prescribe this, or this, or even patient would have taken those themselves. Now, even if you've started a patient on drugs and you now take these cultures, the organisms and whatever your culture is not going to give you a true picture of the status of the organism that is causing it. Now, when you keep doing that, you can imagine that you are just using antibiotics blindly. This also can increase the risk of antimicrobial resistance occurring. Obviously, another factor is a lack of adequate facilities. Like as I said earlier, some most healthcare facilities don't have basic facilities like good hand wash, don't have water running, don't have enough gloves, don't have enough of all these medical supplies. And so there's tendency to want to, reuse things and all this kind of, increase the chances of transfer of antimicrobial organisms that are resistant to antibiotics. Well, lack of basic amenities also contributes to that. Okay, next slide. Now, a very, very peculiar one I'd like to discuss is what the COVID-19 pandemic period. Now, we would all agree that the COVID-19 pandemic was a challenging one for the whole world. It rocked the world globally. Now, what the COVID-19 pandemic period just did to every country, that it exposed the weaknesses in the healthcare system globally. Now, countries that are, let me say, preempt, okay, this can happen, well, they handled the pandemic very well. But a lot of developing countries that, were not prepared, the pandemic exposed these loopholes in the healthcare setting. There was an exponential increase in number of admission. And don't forget, earlier I talked about bed spaces that we obviously were overpopulated. Now, with the COVID-19 pandemic, there was increase of admission and all that. And it was at an extension, easy spread was established because these are healthcare facilities that don't observe standard guidelines. Now you are having a lot of patients because the COVID-19 pandemic really, really hits a lot of the healthcare system in developing countries and also developed countries as a whole. Next slide. So, like I can explain, the burden of admissions. A lot of places did not have supplies. There were a lot of hospitals that didn't have basic things like face mask, even gloves and all that. You can imagine. So these are healthcare system that even worsen and increase the chances of transmission of these antimicrobial organisms, organisms that were resistant to antimicrobial. And also there was an increase in nosocomial infections based on poor attitude to hand wash, because some people are still lackadaisical about this whole hand wash. When you see some people see you with hand sanitizer, why are you washing? They're like, why are you doing this? Why are you doing this? Because they are not enlightened. But if the hospitals and the healthcare providers can actually stick to these protocols, this can reduce the incidence of all these diseases, both airborne diseases, waterborne diseases, and all sorts. Okay, next slide. Okay, another part of the healthcare system that's also had an effect on the incidence of increasing organisms that are resistant to antimicrobial incessant strike actions. Now, I don't know about some other countries, but using Nigeria as an example, it's a country where you have strikes, and because of these strike actions, people because of these strike actions, people don't have access to the hospital. Now, during the COVID-19 pandemic period, also there was lockdown. So this lockdown limited accessibility to healthcare. Now, because of this, patients could self-medicate. Now, a lot of patients, they embarked on self-medication because there was absence of expert counsel. They could just say, okay, any fever I have, I need amoxicillin. I go to the pharmacist to get amoxicillin. And anytime they find none of, so all that also, the attitude on the patient's part also increased the incidence of having organisms that are resistant to antibiotics, because there was a lot of abuse during this period. And like I said, during that period also, you also had some strikes. Then now you had a pandemic that caused a lockdown. So imagine those two factors that also aggravated it. Now, one thing that a lot of hospitals noticed that post-lockdown, now when patients were coming back from the whole lockdown, a lot of them were presenting with atypical organisms that demonstrated a high level of resistance. Now, I remember one time where we had a patient, the patient was very sick. We had to admit the patient to the intensive care unit, and we cultured Acinetobacter baumannii from this patient, and this organism was resistant to every antibiotic. Talk about meropenem, piperacillin, tazobactam, any antibiotic. Obviously, we lost the patient because there was no antibiotic. This patient, while at home, had been taking a lot of medication. Now, when this patient was sick, like terminally sick, this patient came to the hospital. We took samples for a blood culture and all that. Now, we cultured the Acinetobacter baumannii. Is not a very, very common organism. Actually, that was my first time of encountering that organism. I've read about it in books, but that was the first time we're going to isolate that kind of organism from a patient, and the organism was resistant to almost every antibiotic that was tested. So now you can see how the healthcare, the lockdown, and the ignorance of the patient actually, caused this. All right, next slide. Okay, another thing during the pandemic period was also there was an increase in vaccine preventable deaths. Because of this lockdown, a lot of people did not have access to vaccinations and all that, and there was a rise in all these vaccine preventable diseases, and also vaccination exercises also were stopped because everybody was scared. You don't know who has this and who has that, so people were just and symptoms were misrepresented because around this period there was a bloom in the use of social media. During the COVID period, a lot of things were going up on social media. These symptoms are this: you feel feverish, you feel this, and everybody was listening to this. And also because of this, they were taking a lot of antibiotics. And we know that when you abuse antibiotics, your immunity can be lowered. And studies have shown that most of the COVID-related deaths, they had conditions that reduce their immunity. So you can all see that it's like a chain of reaction going on because of all this that happened. This next slide. Okay, now I just had to put this two organisms because these are some popular organisms that are known for resistance. Now we know that at some point vancomycin was used in treating enterococci, but now we have strains of vaccine-resistant enterococci. Well, nobody uses chloroquine in treating Plasmodium falciparum, but people abuse ACTs, that the Artemether lumenfantrine, and right now we are having strains of Plasmodium falciparum that are resistant to Artemether lumenfantrine because patients are abusing, and even healthcare facilities are just prescribing. When they just come, you see a patient that has fever, you don't even take time to do basic tests. You just tell it malaria, you treat it. If the patient comes back some week, it's not malaria, you keep wondering, what do? You use this antibiotic and all that. And before you know it, the patient is having some form of organism that is resistant to every known antibiotic. Okay, next slide. So what is the sequelae of antimicrobial resistance? We will all agree that one, increased cost. Now, when you have a patient that has abused antibiotic coming to the hospital, you're going to have to, you want to investigate and you want to start this patient on treatment. Now, most of the drugs that are usually used in a setting where a patient has organisms that are resistant to most antibiotics are usually very expensive. Now, I would use Nigerian setting as an example. Imagine now the patient is resistant to most of these and maybe are sensitive to something like meropenem. Now, a vial of meropenem in Nigeria, I don't know the equivalent of that in dollars or the currencies, depending on the viewers watching. But in Naira, a vial of meropenem is about 12,000 Naira. And the patient might need to take about 3 vials of that. I mean, in a country where you have poverty and the high level, I mean, how would someone afford medications going into 30,000 Naira? It's almost impossible. And we don't really have a national health insurance system that works here. So most of the patients have to pay for their pockets. Now, because most of them cannot pay, what happens? You have we have increased morbidities because increased admissions, also they're accruing more debts and all that. And in severe cases, you can have them dying, increased mortality. Now, another thing again is when you have antimicrobial resistance at its peak, you want to also try some other broad-spectrum fungi. And don't forget, every drug has a potential to become a poison. And even if this drug, most of them become less efficacious, they can actually be toxic to the consumer and also increase morbidity and mortality in these patients. All right, next slide. All right. So in summary, just to wrap it all up, as was said earlier, antimicrobial resistance is one of the canker worms that's eating the healthcare setting and the health of the world as a whole. And I'm happy we're having a program like this to enlighten the public about the use of antibiotic. It is not everything you have to use antibiotics for. And also from this, also I've been able to expose to us how the healthcare system has also, well, in a way, negatively impacted on antimicrobial organism resistance. And also I've been able to also highlight some loopholes and how we can work on that. So in closing, I'd just like to say antimicrobial resistance is a pandemic on the rise. And the best we can do is to be disciples of antimicrobial stewardship to nip this disease in its bud. And well, the world is counting on all of us. Thank you very much.
So thank you so much, Dr. Sina, for that wonderful talk. So now we'll be proceeding with a brief Q&A portion. Just one question, unfortunately, due to time constraints. So the question is, how likely is it that a patient with viral pneumonia will become infected with a bacterial agent during hospitalization?
Okay, sorry, can you come again? I didn't get that well.
Okay. How likely is it that a patient with viral pneumonia will become infected with a bacterial agent during hospitalization?
All right, thank you very much for that question. Now, a patient has, like you said, the patient has a viral pneumonia. Now, the patient comes to the hospital and the patient is admitted. Now, in the early phase, depending on the pneumonia, don't forget we have various agents that cause pneumonia. There's something called superinfection. Now, when a patient is on admission, there are a lot of things that that are put in the patient, for care. The patient have intravenous lines. They could have catheters. Depending on other comorbidities, there are other interventions. And because of all this, you can actually have a super infection. And while the patient has a viral pneumonia, you can have infections coming through this. Now, for example, imagine a patient is on catheter and is not well catered for. E. coli and all those organisms that are in the urinary tract can go on, cause sepsis in the patient and all that. Now, if the patient is on a ventilator, patient can have a ventilator-associated pneumonia and all that. It can have super infection with other organisms. So the fact that a patient have viral pneumonia, we know one of the complications even of a pneumonia is what we call super infection. You can have a super infection by a more virulent organism, which then complicates the pneumonia. So it is very, very possible.
So thank you so much, Dr. Sina, for your answer and for also talking about the impact of healthcare services on AMR, especially in the context of Nigeria's health system, which I'm sure many global health enthusiasts are curious about. I also loved how you contextualize AMR to the COVID-19 pandemic. So unfortunately, our final speaker has a prior commitment and we have a 30-minute delay. So she'll be speaking at the end, later on, around 30 minutes from now. Before that, I'd like to invite the previous speakers to turn on their cameras as we will be proceeding with the open forum segment, which will last for about 15 minutes. So Dr. Aliu, Dr. Mr. Amrani, and Mr. Ulker, I invite you to turn on your cameras. Okay. Yeah, so we've received a lot of questions from the audience, both on Google Form and on Slido. So this open forum will follow a more free-flowing format. I encourage the speakers to respond to one another, even if the question isn't directly addressed to them. Okay. So the first question is, so in the context of Sub-Saharan Africa, so this is addressed to our two speakers from Africa. So, okay. Sorry. Deaths from antimicrobial resistance in many parts of Sub-Saharan Africa are poorly documented. How can we improve surveillance on AMR to create awareness of this possible pandemic? Perhaps Dr. Sina can start. Or
Okay. So if you were not very audible, can you just come again quickly with the question? I didn't really hear you very well.
Okay, sorry. So the question is, deaths from AMR in many parts of sub-Saharan Africa are poorly documented. So how can we improve surveillance on AMR to create awareness on this possible pandemic?
Okay, all right. Thank you very much for the question. Now, a way to go around that to be one first, like you said earlier, we don't have good surveillance system in Nigeria as a whole. Well, I wouldn't doubt that that's very true. Now, what we need to do first is adequate documentation. Now, which is we have a paucity of that. Now, another way we could get around that is that the world is going electronic. I think if we have more of electronic e-systems, this can actually help, have a common ground where these facts can be extracted. And also very important is reporting. There's a lot of case reports and a lot of things that happen that, that a lot of healthcare systems don't report. So I think if we do in the sub-Saharan setting, if we do more of reporting of our findings, it will also help. Now, another one is also research. Now, it's sad that in this part of the world, we don't have a lot of finances going into research and all that, because all this, we know they are actually present. But because we don't have a lot of research and diagnosis going on, we don't pick up all this kind of organisms. So if you don't have something to pick up, you definitely won't report. And because most of our laboratories also are not well equipped, they don't even make such isolations. They will just tell you that this they did not culture anything from the sample. So I think if our healthcare systems are also well equipped, we can also work together as a team, report when we have this, and enlighten the public, and that by way publish our numbers and publish reports, and together we can have figures to say that, oh, these are the organisms we feel are in the increase causing resistance to antimicrobial. So I think that's the way the surveillance system will work in sub-Saharan Africa and Nigeria as a whole.
Thank you so much, Dr. Sina. Dr. Aliu, would you like to add?
Yes, I think he has given, Olisina has given many of the issues or problems with, getting the data. Yeah, surveillance is really key. We have very poor surveillance systems, both for collecting data on deaths of patients, on what actually is killing the patients, and all that. But also laboratory data is also very poor. Data being generated at the laboratory to some level is not as good as it should be. Then on top of that, we have very poor documentation of this data. Many laboratories are still using paper registration sheets. They are not using laboratory management information system. So if you had that data, you can clearly say, okay, this patient died of sepsis. What is the pathogen that caused this death? And then of course the issue of awareness. We need to enlighten individuals across all sectors on the need to collect this data. And we also need to advocacy to government agencies, ministries and things like that on the importance of such data. Thank you.
Thank you so much for telling us more about how surveillance can be improved and awareness as well in the region and as well as the world. So our next question is for Mr. Amrani, since it is with regards to the animal and food industry. So has COVID-19 impacted the use of antimicrobials in animals and the food industry? And what is the expected magnitude of the impact?
It is a very good question. I think we have more data about how COVID affected the healthcare system in human medicine, obviously, than in animal and veterinary sciences. The thing is, I actually don't know. data about this is very scarce. And what I can say though is veterinary medicine, and especially the food industry, is an essential field of like the industry, because people need to be healthy, people need to be secure, and people need to eat to survive. So in a way, things have been trying to I mean, the industry has been going, but at a lower capacity, obviously, because when you're at a factory, you need to like reduce the number of people that are working because of risk of having COVID. And overall, we've been seeing that the economy as a whole have been scaled down um, because of the pandemic. And I think that the category of people that have suffered most from this are the farmers, because obviously in time of crisis there's also a lot of speculation going on, a lot of uncertainty and a lot of confusion. And yeah, I mean, that's all I can say about this. I know that the effects of it on clinical practice have been felt, because obviously I mean, the WHO also said specifically that in terms of specific needs, walking your animal is a specific is something that you need to do, and people were allowed to go out 2 times a day to walk their dogs. And it's interesting to see just how the veterinary profession has kind of adapted in terms of clinical practice, just receiving animals and like putting up all those barriers and stuff. But the food industry, we do not have, I do not have enough data, unfortunately.
Okay. Thank you so much for your response, Sir Amrani. So the next question is addressed to no one in particular. So how can we have better control over antimicrobial supply to the community, since most antimicrobials can be bought over the counter? Who would like to respond?
Maybe you should choose. Okay.
Go ahead, Sir Amran.
Yeah, so a very big talking point in veg medicine is the access of farmers to medicine. Because obviously when you are trying, or like a farm is basically a business, and the objective is to cull down your costs in order to create more benefit for yourself. And it's not as easy as it sounds. So sometimes you have to like cut down on veterinary consultation costs, because they cost a lot depending on where you are. So what happens is farmers are like learning more and more about the diseases that we are treating, and they start recognizing those diseases, and they start using medication to treat them or to prevent them. In a lot of places, this is done under veterinary care or with veterinary consultation. But in a lot of other cases, specifically when you have farmers who don't have like a lot of animals, perhaps in big ranches, then it is done with under veterinary care before, because usually they have contracts with the veterinarians, so they're being closely monitored and they keep records. But when you have farmers that like have little patch of land and 2 cows and 3 sheep, then obviously the investment of having a veterinarian come over is not as like it doesn't make sense. So a lot of farmers actually do automedication. The bigger danger of that is that not only they have access to antibiotics and other medication, but also they are less likely to keep records of it. So we don't know if they are buying antibiotics. Like, we know they are buying antibiotics. We don't know how much they are buying, and we don't know how much they are using, and we don't know how they are actually using it. So a big talking point has been just like engaging with the farmers and trying to better educate them, and because they are a stakeholder in this when it comes to antibiotic use for growth promotion, of course.
Thank you so much, Mr. Amrani. I think Dr. Ali, you were raising earlier. Yes.
Yes. I hope you can hear me.
Yes, we can hear you clearly. All good.
Yes. Yeah, I think this is a very huge problem in developing countries. As I said, you can virtually buy, I mean, just imagine having to buy, I'm sure for many of those that are from Europe, you know, it will be a frightening thing, and even from Asia, I think to some extent. But so people buy, you know, can buy anything. But I think there are essentially 4 steps. One is awareness. We need to make the public be aware that you know, there are risks, and you know, that's one. Then even those that are selling these drugs are not aware of all the risks that are involved. So they also need to be made aware. Then 2, the issue of regulation. You know, regulation laws that, you know, will ensure that selling these drugs over the counter to anybody is wrong. He must have a prescription, you know, before you can sell these drugs. So the issue of regulation is very, very important. Then the issue of enforcement. So you have regulations, you must enforce them, you know. So you must have either empower the police or create even an agency that will enforce such, you know, such regulations. And then, of course, lastly, penalties. You know, if you are caught wanting, then you should be punished so that someone else will learn that, okay, if I do this, I'm going to get punished, either a huge fine or maybe, you know, a huge fine, for instance. That will discourage others from going into, you know, being involved in these practices. Thank you.
Thank you so much, Dr. Aliu. So the next question is addressed to Mr. Ulker. So the question is, what are your thoughts on lesser adaptation of or lesser adoption of the WASH agenda in low to middle income countries? I guess this can also be addressed by the others later on. But then Mr. Ulker was the one who mentioned it earlier in his presentation.
I think it's about the policy making processes and the development of the policy making. So to be honest, actually, what is the improvement of policy making and what we call as the improvements are actually the European-based system. But sometimes those policy making system and making them actually real might not work in the other countries, like in the Asian countries or the African countries. Even in my home country, which is Turkey, sometimes also we have the difficulty in adaptation on the European policy making processes. So I think for the countries that are not that much involved in the policy making, it is really important to get in touch with WHO and like CDC, for example, the actual associations that are worldwide and that can get themselves adapted to the country's specific solutions. Because when you look at the, when you try to copy these solutions that were maintained for example, another country that is very different than your culture and your system, then you might fail to adapt them. But if you create your own system based on your country tailored specifics, based on your needs, for example, you need something more than the others, and you should be defining them basically, and you should be getting in contact with those associations. And I think WHO has been working greatly on that. But Also, just to give more information about how it is going on in Africa and also Asia. I think our speakers might have more knowledge on that, and that is kind of my view from the, like, I think, European and Middle Asian area, I can say, as a Turkish person.
Thank you so much, Mr. Elker. Would anyone from the panel like to add? Yes, Doc. Okay. With that, we've exhausted the time for this segment. Thank you. Thank you so much. It looks like our sixth speaker is already here. So we will be proceeding with her talk. But before that, I'd like to thank the panelists for the wonderful presentations. The greatest commonality across all presentations is the need for multi-sectoral collaboration, effective policy, and awareness in response to a public health challenge of this scale. So now we may proceed with the next presentation, the final presentation. So we've had speakers in the fields of medicine, pharmacy, and veterinary medicine. Our final speaker is actually a dentist. So we have Dr. Wendy Thompson. She is a clinical academic dentist at the University of Manchester. Her research interests include dental antibiotic prescribing and for people with acute dental pain and infection. She is the lead author of the FDI World Dental Federation's white paper on tackling antibiotic resistance and the lead educator for its accompanying online course. She is an honorary consultant to the Office of the Chief Dental Officer and an ambassador for the College of General Dentistry, a member of the British Dental Association's Health and Science Committee, and the British National Formularies Dental Advisory Group. She's also a specialist advisor on dental antibiotic prescribing and stewardship to the National Institute for Health and Care Excellence. With that, I'd like to welcome Dr. Wendy Thompson.
Thank you very much for that kind introduction. I'm afraid my video isn't working on my computer today, so I apologize about that in advance. If you go on to the next slide for me. Perfect, thank you very much. So I apologize for being late. I had another meeting that I needed to go into, so better late than never. And I'm sure you've probably already all talked about this, but antibiotics are life-saving drugs. When people need them, they really need them to work. So this patient, as you can see, has got a dental infection, and the neck is a very small area, really. It's got lots of very important things running through it. And if someone gets an infection which swells up their neck, then that can be life-threatening. The head and neck also have an important structure called the brain in it. And again, if an infection spreads and gets into the brain, then that's not happy days for the patient. So head and neck infections are very, very important. And antibiotics are really important for people with those infections. They need those antibiotics to work for them. You go on to the next slide. And there you are. When people need antibiotics, they need to work. So next one again, please. So treating dental pain or infection doesn't usually need antibiotics. It needs maybe to have someone rinse out with some hot salty mouthwash, maybe to take the tooth out. You can see that tooth there has got an abscess on the end of it. Maybe to take the nerve, oh, go back again, sorry for me. Maybe to take the nerve out of it, that's the little file down at the bottom, and that little string of red is the nerve from inside of the tooth, or maybe to give a prescription. So you go on to the next slide now. And access, so the numbers of dental antibiotics are impacted on the decision to prescribe a dental antibiotic is a clinical one, but it's impacted on by lots of non-clinical factors. And if any of you look at the research that I published recently, you'll see that there in English urgent dental care alone, and there'll be other factors in other parts of the world, but there are 34 factors influence NHS dentists, National Health Service dentists in England influence that decision. Non-clinical influences on that decision. And access alphabetically was the first one of those. And COVID gave us a very interesting time to explore that, because dental services in the UK, if you click once for me, click once. Can you click the button for me? Thank you. So dental practices, oh, go back again. Dental practices closed on the 23rd of March. We only had urgent dental centres open after that. And as you can see, the blue line and the orange line are the dental antibiotic prescribing rates over the last few years, last couple of years. And then the grey, lilac, whatever coloured line it is in, that goes up is the prescribing rate this year. And as you can see, after dental practices closed on the 23rd of March, it increased quite steeply. And when they reopened on the 8th of June, then it started coming back down again. So restricted access to dental procedures had a big impact on the rate of dental antibiotic prescribing. You go on to the next slide, thank you. And antibiotics have benefits as well as risks. So it isn't just a case of, you click once more for me. Just click once, that's it. Yeah, back again. Or you can click once more if you want. And so antibiotics have benefits as well as risks. So the benefits are that they treat life-threatening infections, but they have to be balanced against the risk, because if you give an antibiotic for something that isn't a life-threatening infection, then it can cause, well, even if it's a life-threatening infection, it can cause an anaphylaxis. Or click again, it can cause C. difficile infections. Click twice if you like, and click again. So anaphylaxis, C. difficile, or antibiotic resistance is the third one. When it clicks again, it will show a star on there. Click again for me. Oh, that's done something funny with the. And if the infection that the person had in the first place was resistant to antibiotics, it didn't respond to antibiotics, then you can imagine that that infection on the left-hand side of your screen is going to carry on getting worse. And that can have a fatal outcome for the patient. And so antibiotic resistance, when people need antibiotics to work, they need them to work. And you need to be only prescribing antibiotics when they actually need them, because the risk otherwise of anaphylaxis or C. diff or antibiotic resistance or any of the other adverse events to antibiotics don't outweigh the need for antibiotics. So a bit of toothache, antibiotics don't cure toothache, and a little bit of toothache is not an indication for an antibiotic. Dental infection might be, although there are still surgical procedures which you should be undertaking rather than just giving an antibiotic. Can you go on to the next slide, please? Perfect. So the FDI World Dental Federation published its white paper the week before last. I was the lead author of that white paper, and it links its main priorities through to the World Health Organization's Global Action Plan. FDI selected three priorities in particular. It selected awareness raising, infection prevention and control, and antimicrobial stewardship. There's three ways in which dentists, dental teams even, can help tackle antibiotic resistance. So if you go on to the next slide for me, I'll go through each of those individually. Thank you. So awareness raising is about the role dentists and members of the dental team are trusted by their patients and by members of their community. And as clinicians, you're all, student clinicians, you're all also trusted by your family and your friends and people in your communities. So you have a really important role in terms of raising awareness about antibiotic resistance, about the risks of antibiotics, and about stewarding them, about guarding them for future generations, because none of us want to grow up in a world where antibiotics don't work for our grandchildren. And there's a campaign called the Antibiotic Guardian campaign where you can select a pledge, and I would encourage you all to do that at this website. You go on to the next slide for me. So we go on to the preventing infections. So you may not think about dentists as preventing infections, but actually if we, what this infographic shows is that if you have less tooth decay, you then get less infections. If you have less infections, you then need less antibiotic use. And if you have less antibiotic use, then you have less antibiotic resistance. So actually by preventing people getting tooth decay, it's a really important antimicrobial intervention. And you prevent tooth decay by, well, the only way you can get tooth decay is by having sugars in your diet. And so if you keep sugars to meal times, your body can cope with it. But the more sugar you have in between meal times, and in particular in drinks, so hot drinks, fizzy drinks, energy drinks, Monster energy drink is a bit of a bane of dentist lives, then that's where tooth decay comes from. You can help mitigate some of that. You can help prevent tooth decay with fluoride. But if you don't have the sugars there in the first place, then the tooth decay's got nothing to form on. And antibiotics don't cure toothache is the bottom line message. Pain relief is best achieved by a dental procedure, not a prescription. So we go on to the next slide for me. Antibiotic stewardship is about optimizing the use of antibiotics, and I'm sure you'll have heard lots about this during the conference. Antibiotics should only be prescribed when strictly necessary, and each nation needs its own national guidelines, which I think I'll talk about a little bit more on the next slide. And then dental teams and in your own services, medical teams need to, and veterinary teams presumably on here as well, need to audit their prescribing against the national guidelines to check that you're optimizing use. And you need to educate your teams in what you're doing and why the importance of doing it, just because what you find is a lot of the older clinicians trained before there were guidelines in place, and people tend to follow their patterns of practice on what they did when they trained. So you tend to find that older clinicians tend to be a lot more free and easy. Certainly people who trained in the 1970s when antibiotics had all the benefits and none of the risks carry on their patterns of practice like that, and the risks now are much greater than they were back in the 1970s and 80s. So it's really important to bring all members of the team on side, and educating patients as well about why antibiotics aren't going to help them, why they need to have a procedure rather than a prescription. And we've got lots and lots of different resources in the UK, and they're brigaded together under this UK Dental Antimicrobial Stewardship Toolkit, with a website there that we're all welcome to go and have a look at. It's all free to access. Go on to the next slide for me. So I just wanted to talk briefly about guidelines. You can click once more as well, please. Guidelines differ around the world, and that's for very good reasons. There isn't a one-size-fits-all solution. Guidelines need to take into account local patterns of antibiotic resistance. You click once more for me. And also access to dental care. Patterns of access to dental care. So there's going to be a map here that shows up. And what I did, I selected a bacteria, Enterococcus faecalis, because that's got dental links. Go back, sorry, one more. That's it, thank you. And I selected aminopenicillins because amoxicillin is one of the most prescribed dental antibiotics. And what you can see on the map of the world there is that the dark colours are where you have resistance of Enterococcus faecalis bacteria to aminopenicillins like amoxicillin. And so guidelines for dentists based in, say, India, which is one of the dark areas, or Belarus, or Zimbabwe, where they have high rates of resistance of Enterococcus faecalis to aminopenicillins. Guidelines in those countries would need to be quite different to guidelines in, say, Australia, where they have very much lower levels of resistance. And so this is why you can't have one-size-fits-all guidelines around the world. They need to take into account patterns of antibiotic resistance, but they also need to take into account patterns of access to dental care. So, for example, in some parts of Africa, people will walk for days to go and access urgent dental care, to go and access a dental procedure. Whereas if you're in downtown New York or downtown London, you should be able to access dentistry within the hour if you need to. So they're very different contexts. And I'm sure you've heard from other speakers that antibiotic prescribing is context specific. And so if you're going to develop interventions to optimize antibiotic use in your area, you need to really understand and diagnose the problem in your area. You go on to the next slide again for me, please. This is the final slide. And to find out more, we have a MOOC, a massive open online course, which is a free course for people to access, which was established for the World Antimicrobial, launched in the World Antimicrobial Awareness Week, but it will be run on a regular basis. I'm the lead educator for it, and really it's the FBI white paper, but in a more interactive format. And if you follow the activities as the course goes on, then you will end up with a tailored action plan that's allowed you to think about the context in your own area and what sorts of actions you can be doing to make a difference. Thank you very much.
Thank you so much, Dr. Thompson. Now we have one question for you for the Q&A portion. So to what extent is the role of dentists in advocating for AMR formalized? Like, is it emphasized in their curricula, or is it an interest that is more common among dentists specifically into public health?
Yeah, it's an interesting question, isn't it? Again, very different in different parts of the world, and depends where you train. Certainly in the UK, it's advocated as being a very important aspect that members of dentists in particular. It's an interesting point, really. So our people who work in the wider dental team tend to get less training people who work maybe on with the reception team, they have a really important role, and yet they tend to learn on the job from just people who've been there in the role already. So if you call up at 5 to 5 on a Friday with toothache, and the practice closes at 5 o'clock or 5:30, you're going to get a very different, and the receptionist has booked you in at 5 to 5 on a Friday. You're going to get different treatments to if you turn up at 10 to 10 in the morning and the dentist has half an hour to do what they need to do. And so it's about teaching receptionists that, and the other thing is if a receptionist says, yeah, I'll book you in for 5 minutes, they'll give you an antibiotic and then you can get gone. That's going to give a very different expectation on behalf of the patient when they come in to see you than if they've said, oh, I know you might only want antibiotics and think that you need 5 minutes for it, but you and I don't know what the dentist is going to find. So let's book you in for a half-hour slot and then the dentist can get on and do what they need to do and you can work it out together. So it's about the full dental, about the full team. How much it's taught is very different in different areas and by different people as well. So we tend to have our newly trained dentists have their first year after graduation in the, if you like, the tutelage of a more experienced dentist. And they tend to be a dentist who trained in the 1970s or 80s. And as I said before, they tend to be the dentists who are not really following guidelines as closely maybe as some of the younger, more recently trained dentists. And so the different messages that people get at different stages and the different messages that patients get are quite different. So I think wherever you are, I think that it will be extremely good for you to advocate for this.
Thank you so much for that, Dr. Thompson. And also for sharing with us today the dental perspective on the issue of AMR. Like, it's really exciting to be learning concepts I've never encountered before as a medical student. And I'm sure our audience here today agrees as well. So with that, that concludes the presentations for today's webinar. I'd like to invite the speakers to stay for a bit longer for the presentation of certificates. It's been a pleasure moderating today's sessions. Now I'd like to call on our MC, Laura, along with other officials of AMSA International to present the certificates to the speakers.
Thank you. Sorry, I was muted. Those were such wonderful presentations. I know you all agree and we all learned a lot. Personally, I kept scribbling notes and notes and notes on my book, and I would really love to thank everybody for staying up to this long for the webinar, for participation. We really had a lot of questions. We thank you, and in a great and special way, I would like to thank our panelists. You have done a marvelous job. We appreciate from the bottom of our hearts. From the side of the organizers, we say a big thank you. Now we would like to present certificates to show our appreciation. You know, here in Africa, you just don't come to Africa and leave empty-handed. We must give you something, you know, something to take home, something to show you that we are grateful, to tell you thank you. So what we will do, our panelists, we will just enable your video so that we can, when we project your certificate, and also we take a screenshot of the same. So our first panelist is Dr. Roger Harrison. We are taking this opportunity to thank you, and thank you from the bottom of our hearts. And we thank you for your contribution to this webinar and the whole Antimicrobial Awareness Week campaign. Someone to take the screenshot. Is Dr. Roger Harrison in? Oh, okay. I am informed he's not in at the moment. But anyway, We thank him. We move to the next. Pardon me if in any way I pronounce a name in an appropriate manner. You know, some names are tongue twisters to some of us, so please bear with us. Our next panelist is Mehdi Amrani. Thank you a lot for gracing our webinar today. So we can take a photo of it. Done already? Done. Our next one, we have Bake Akad. Please pardon me, but we have Bake Akad. Thank you a lot. I can see you. Thank you a lot. We appreciate our photo.
Thank you very much.
You know, something else, we move on to the next one. Something else I love about webinars and such interactions is that I get to learn so many names I've never heard of. You know, I'm used to 10 some names in Africa that I've not heard of. So it's a nice opportunity. The next panelist is Dr. Shamsuddin Aliyu. You are a great inspiration to me, and thank you for honoring our invitation. Photo, please. Yeah, I think it's done now. Our next.
Thank you very much. Thank you.
Okay, welcome. Our next is Dr. Lucina Michael. Thank you a lot, bearded doctor, for gracing our webinar. You gave really insightful comments. We appreciate.
Thank you so much for having me.
Okay. Our next panelist. Yes, and our next panelist is Dr. Wendy Thompson. I don't know if she will be able to enable her camera, her video. Is she present?
Hello, can you hear me?
Yeah, I can hear you.
Yeah, no, I can't get my camera to work for some reason.
Okay, it's okay. At least we'll have your name there. It's okay. Photo, please.
I'm sorry.
Yeah, done. Thank you everyone for attending this webinar. I hope that this is not the last time you are able to interact in conversations around antimicrobial awareness. I hope whatever you have listened to today, you have learned today, you're going to, you know, even over a meal with your friend, tell them, oh, I learned this and this and this. Ask them, how have you washed your hands today? You know, such things. Let us continue this conversation even in societies. We were told we are the young people who can, you know, bridge that gap. Let's continue that way. And now I would like to welcome Kush to finish up. Thank you.
Thank you so much, Laura, and thank you again to all the speakers. I apologize, my throat is a bit bad, so I might be sounding a bit rough. It was a great session. So first of all, I'd like to thank again all our wonderful speakers for the insightful discussion and for making their time out of the busy schedules for a speaker. Thanking again our moderator, Leonard, who did a wonderful job moderating the session today. And now, before we discuss the last aspect of the webinar, wherein we share the post-event evaluation and more opportunities, I would like to request all the participants and present speakers to switch on their videos so that we can have a virtual group photo. Thank you. I hope everyone has switched on the video. So we have 7 pages, so please bear with us for another 2 minutes while we click on the pictures. So first picture, 1, 2, 3. To the second panel. To the next panel, 1, 2, 3. And to the next panel. And to the next. And we are all done. Thank you so much, everyone. Just give us another 2 minutes while we brief you with a little bit of the opportunities and share the post-event evaluation. I'd request all the participants to please fill the post-event evaluation form. We will also share it over to your designated emails so that we can allot the certificates of attendance as well as participation for the event. We thank you again. And here I would like to share more opportunities that you can look out for, which will also be sharing over to your emails that you have shared with us. Allow me to share my screen for a second again. So as it has been stressed upon by many of our speakers, that the action to World Antimicrobial Awareness and to tackle AMR is not just about the week, but to extend the activities beyond the week and to ensure we make a long-lasting impact. As this is the race for the long run and not just today. So 2 major events that we have organized in association with our partners, co-organized by Asian Medical Students Association, AMSA International, and Federation of African Medical Students Association, FAMSA, in collaboration with European Medical Students Association, EMSA, International Association of Dental Students, IADS, International Veterinary Students Association, IVSA, and Asia Pacific Dental Students Association, APDSA. So first is the WAAW Think Global, Act Local campaign, wherein you can enroll your activities that you have organized between 18th of November till 18th of December in our joint campaign. We'll be sharing the link to the campaign as well as the reference module for you as to what kind of activities you can organize under the campaign, as well as get them accredited from us. Second is the WAAW, Multidisciplinary One Health Design Sprint, wherein we will be making multidisciplinary inter-health design teams, wherein each team will consist of participants from various fields of healthcare as well as other fields, and will be working on one specific pillar to tackle AMR. These teams will be working on the desired pillar for a total period of around 3 weeks, and the design sprint will close on 20th of December and will start this weekend, 29th. The link to registration will be sent to your mailboxes by tomorrow, that's 25th, as well as will be shared by all the organizations to their members if anyone is interested in participating. This design sprint aims to encourage the participants to think critically and think of innovative solutions and ideas to tackle the problem of antimicrobial resistance while following the One Health approach, thus empowering the youth to take an action and build innovative solutions for approaches beyond the World Antimicrobial Awareness Week as well. With this, we thank you again for your kind attention and participation to this event. We hope you had a great time and great insights participating in this discussion and learning more from it, and can be better antimicrobial stewards of the future. And we look forward to seeing you at more such events, and soon in WAAW events, as I mentioned, WAAW Think Global, Act Local campaign, as well as WAAW Multidisciplinary One Health the Science Fair. Thank you again. With this, I will share the link to the post-event evaluation and the attendance form. So this is the link to the evaluation, post-event evaluation. It goes bit.ly, WAAW One Health post-webinar eval. You can directly search it. We will also share the link in the chat box. Kindly click it and fill this 2-minute small survey, which is also a feedback for our committee who has worked hard to organize this event and can hopefully improve in our future events. Thank you again. The room will stay open for 10 more minutes so that the participants can take their time and fill out the form. The form will stay open till tomorrow, 25th November, 14:45 GMT, 22:45 GMT +8. We thank you again. Hope you had a great time. Now I would like to request my supervisor, Velia, to give the closing remarks, followed by our overall chairperson, Marjorie, to give the closing remarks.
Okay, I'm afraid that Val has passed the baton to me first. Okay, so hi everyone. I'm really, really touched to see all of you still awake with us. I'm from GMT +8, so I'm literally dying right now. And thank you so much for staying so long despite having your classes and your busy schedule, and especially to our speakers and to all of you from all over the world. Thank you so much. This is a really blessing today. I rarely see, or should I say, have we ever seen, Velia? Such a big collaboration.
No.
Nope. Okay. Yeah, so it's the first time for our organization, and having you guys being part of it is really something I can never imagine. And thank you, and I hope that all of you will be safe throughout this period of uncertainty, and maybe see you guys, fingers crossed, one day. Okay, and congratulations to the committee. You guys did really well. Thank you. So maybe Velia.
Thank you very much, everyone. This goes to all the panelists, all of our partner organizations, to everyone here participating in this webinar today. It has been quite a journey for all the organizers, but we are glad that we have come to this day, and we have quite successfully unite a lot of people from very, very different backgrounds here to talk about antimicrobial resistance. So I'm very grateful that everyone is here, to all the panelists, to all the organizers, to all the partners. And we really hope this kind of partnership, this kind of collaboration to unite everyone to, strive for one health approaches together can be continued. And yep, cheers to future more opportunities. Thank you so much, everyone. Have a nice day.
Thank you. And we should totally